Skin Condition Disorder Guide. Chapter 1. Skin Problems/Dermatology. Skin Disorders Guide. Skin color depends on how much melanin a person produces, which is determined by genetic inheritance. Freckles and moles are melanin blemishes which could get darker and bigger with exposure to the sun. Birthmarks, clumps of blood vessels near the surface of the body, can also cause blemishes in the uniform skin color of the body. Chloasma melasma gravidarum, also called the mask of pregnancy, is a condition of the darkening of the skin that afflicts some women during pregnancy and when they take birth control pills. Addison's disease could cause darkening of the skin, hyperpigmentation. Albinism, somebody with pale white skin of no color, is a genetic disorder in which the melanin cells cannot produce melanin. A variety of spots appear on your skin as you get older, but most are harmless. The skin can be irritated by many substances and cause a rash, which is the most common skin disorder. Rashes are reddish inflamed skin caused by any of a number of things like exposure to certain chemicals, plants, substances, urine, feces, or mild germs, bacteria and viruses. A heat rash is caused by perspiration, sweat. Rashes can move up to blisters, ulcers, drying, cracking, hardening of the skin, or even eczema in cases where the irritants are quite severe. With rashes, you have to identify what caused it, remove this irritant from the environment, then seek treatment. Often the removal of the irritant is enough. The rash will clear up in due time. Age spots, liver spots, or sunspots, also called lentigines, are brown spots on the skin that resemble freckles. They are a sign that the skin is trying to protect itself from the sun by producing a pigment to help absorb the damaging sunlight. Age spots appear in almost everyone as they get older, especially in fair-skinned people. Age spots most commonly occur on the face, arms, hands, and tops of the shoulders, body parts that are frequently exposed to the sun. You can purchase a non-prescription skin bleaching cream to help fade the spots. There are laser treatment to break up the pigment, color, in the spots, or a chemical skin peel that uses a mild acid to remove the top layer of skin. An actinic keratosis or solar keratosis is a skin growth that has a rough surface. It can be red, skin-colored, or white. It is caused by excessive exposure to the sun over time. They usually develop on fair-skinned people during middle age or old age. An actinic keratosis can develop into a form of skin cancer known as squamous cell carcinoma. Actinic keratosis can be permanently removed with surgery, including laser treatment. A cherry angioma is a bright red spot composed of a collection of tiny, closely packed blood vessels near the surface of the skin. Cherry angiomas can develop on any part of the body but are most often found on the trunk. Cherry angiomas that appear on the face can be removed for cosmetic reasons. Nevus is a general name for a variety of blemishes on the skin. Most pigmented nevi are harmless, but some nevi are malignant. Generally the bigger and the more irregular shaped as opposed to circular, the greater the chance it could be malignant. Freckles, colored blemishes on the skin. Moles represent an overproduction of skin cells producing the pigment melanin. They are skin growths that can appear on virtually any part of the body. Moles usually enlarge slowly over time, becoming elevated and lighter in color. Some eventually sprout hairs. Moles that are present from birth are known medically as congenital nevi. Atypical or dysplastic moles are moles with a non-circular shape. Irregular shaped moles are a warning sign for the possibility of skin cancer. Any mole that is asymmetrical, has an irregular border, displays an uneven color, or is larger than a pencil eraser should be examined by a dermatologist. Most moles are harmless. A doctor can remove a mole by shaving or cutting it away and then stitching the nearby skin closed. Port wine stain, large, flat, purplish-reddish marks on the body. Seborrheic keratoses are tan, brown or black raised, crusted, or waxy age spots. Seborrheic keratoses are harmless. A doctor can easily remove a seborrheic keratosis for cosmetic reasons with liquid nitrogen, scraping them, burning them off, or cutting them off with a scalpel or scissors. Skin tags are small, ash-colored or light brown flaps of skin that protrude from the surface of the skin. Doctors can easily remove skin tags for cosmetic reasons by burning them, liquid nitrogen, or cutting them off. Stork bites, small, flat marks on the back of the neck. Strawberry mark, a benign blood-filled tumor, sometimes called a capillary hemangioma. Dermatology, the medical specialty for skin disorders. Dermatology is the branch of medicine that deals with maladies of the skin, nails, and hair. Find books on dermatology at number 616.5/0022/2 or RL81 at the library. The major topics are as follows: psoriasis, eczema and dermatitis, inflammatory dermatosis, rashes with epidermal changes, rashes arising in the dermis, blisters and pustules, leg ulcers, acne and rosacea, the hair and scalp, diseases of the nails, lumps and bumps, the sun and the skin, black spots in the skin, skin systemic disease, genetics and skin disease, cutaneous immunology, autoimmune disease and the skin, bacterial infection, viral infections, AIDS and the skin, fungal and yeast infections, insect bites and infestations, tropical dermatology. A dermatologist is a real doctor. Dermatology is a specialty within the medical field for skin and nail problems. They generally don't do things to help your skin look younger. They treat skin problems. Many beauty care businesses use the word dermatology to make it sound like they do high-tech vanity skin treatments. Skin product sellers used the word derma to make it sound like they got some scientific product, but it's all fraud. American Academy of Dermatology. AAD.org. Chapter 2. Lists of skin disorders. A list of skin diseases and conditions. Abscess. An abscess is an infection characterized by a collection of pus underneath a portion of the skin. Bacteria commonly causing abscesses are Staphylococcus aureus and Streptococcus. These bacteria enter the skin through any cracks or injury to the skin. Acanthosis nigricans. Acanthosis nigricans is a condition characterized by abnormal thickening and darkening of the skin, especially in body creases. It is most commonly associated with obesity or polycystic ovarian disease in women, though it can occasionally be found in people who have more serious underlying health problems or who are taking certain medications. Acne, acne vulgaris, acne, also known as acne vulgaris, is thought to be caused by multiple factors. Overproduction of a normal oil on the skin, called sebum, increases under the influence of hormones. This, coupled with insufficient shedding of exfoliating dead skin cells, plugs hair follicles. Acne, neonatal, benign cephalic pustulosis. Babies can develop blemishes on their face that look exactly like acne commonly seen on adolescents. Although the cause of baby acne is unknown, it may be the result of maternal or infant hormones, androgens, stimulating glands in the face to produce oil, or sebum. Acne excori. Acne excori, also known as Picker's acne, results when acne lesions are compulsively squeezed and scratched, resulting in scabs and scars. It is seen most commonly in adolescent girls and has been thought to be associated with underlying depression, anxiety, or emotional problems. Acne keloid alisnuki. Acne keloid alisnuki, also known as keloidal folliculitis or nuchal keloidal acne, is a chronic skin condition characterized by inflamed bumps and scars on the back of the neck. Although it is not related to common acne, acne vulgaris, acne keloid alisnuki initially appears as acne-like lesions of inflamed hair follicles, folliculitis, on the nape of the neck, nuchal area, and, without treatment, can result in large scars, keloids. Acne treatment, laser. A variety of methods involving light can be used to improve acne. A popular approach is to combine an infrared laser with skin cooling to target oil gland production, a key element in acne formation. A second approach involves a chemical that makes the oil gland and follicle sensitive to light plus the application of a bright light such as a laser, intense pulsed light, or lamp. Acne vulgaris, acne, also known as acne vulgaris, is thought to be caused by multiple factors. Overproduction of a normal oil on the skin, called sebum, increases under the influence of hormones. This, coupled with insufficient shedding of exfoliating dead skin cells, plugs hair follicles. Acrocordon, skin tag. A skin tag, acrocordon, is a common, possibly inherited condition that manifests as small, flesh-colored growths on a thin stalk. Skin tags are benign lesions that can sometimes become irritated or traumatized. Actinic cheilitis. Actinic cheilitis, sometimes known as farmer's lip or sailor's lip, is a precancerous condition related to cumulative lifetime sun exposure. The lower lip is most often affected. Individuals with actinic cheilitis often present with complaints of persistent dryness and cracking of the lips. Actinic keratosis, solar keratosis, actinic keratosis, also known as solar keratosis, are small rough or scaly areas of skin due to damage from sun exposure. Some actinic keratoses can turn into squamous cell skin cancer, so it is important to perform self-examinations often and catch them early. Allergic contact dermatitis. Allergic contact dermatitis is a delayed hypersensitivity reaction. The reaction to the allergen occurs 48–72 hours after exposure. The most common allergens causing allergic contact dermatitis appear to be nickel, chromates, rubber chemicals, and neomycin, an antibacterial. Allergic contact dermatitis, pediatric. Allergic contact dermatitis is an allergy to a substance, the allergen, touching the skin. The reaction occurs 48–72 hours after exposure. Common allergens are nickel, chromates, rubber chemicals, and neomycin, an antibacterial medication. Alopecia, female pattern baldness. Alopecia is a form of hair loss affecting women due to an inherited susceptibility. It is most commonly noticed after menopause, although it may begin earlier. Alopecia, male pattern baldness. Alopecia, or androgenetic alopecia, is the patterned balding of a man. Although the condition may affect both the appearance and self-esteem of some men, one should note that the condition is not a medical disorder. Alopecia areata. Alopecia areata is an autoimmune condition resulting in hair loss. The immune system of the body mistakenly stops hair growth for unknown reasons. Anesthesia for dermatologic surgery. Local injection of anesthesia is a commonly used method to numb a small area of skin undergoing a surgical procedure. Patients can undergo a surgical procedure with no pain while remaining fully conscious with the use of local anesthesia. Angular cheilitis. Angular cheilitis, perlesh, is a chronic inflammatory condition of the corners of the mouth. Usually associated with a fungal, candidal, or bacterial, staphylococcal, infection, those affected may also have thrush, oral candidiasis. Animal bites, first aid and self-care information for animal bites. Bites can be caused by wild animals and domestic animals, including humans, and they can range from mild to serious. It is important to assess both the severity of the bite as well as the risk for infection to determine the appropriate first aid and care. Anthrax. Anthrax is a disease caused by the bacterium Bacillus anthracis, a bacterium that has the ability to form spores. Spores are cells that are essentially dormant, asleep, but may become active under certain conditions. Anthrax disease can take three forms. Athlete's foot, tinea pedis. Tinea pedis, also known as ringworm of the foot or athlete's foot, is a superficial, fungal infection of the skin of the foot. The most common fungal disease in humans, athlete's foot, may be passed to humans by direct contact with infected people, infected animals, contaminated objects, such as towels or locker room floors, or the soil. Avian influenza H5N1, avian flu, bird flu. Avian influenza, or bird flu, is the name for a certain strain of the influenza virus that is usually found only in birds but may occasionally be transmitted to humans, sometimes causing a serious illness. B. Baby acne, neonatal acne. Babies can develop blemishes on their face that look exactly like acne commonly seen on adolescents. Although the cause of baby acne is unknown, it may be the result of maternal or infant hormones, androgens, stimulating glands in the face to produce oil, or sebum. Basal cell carcinoma, BCC, basal cell carcinoma, BCC, also known as basal cell epithelioma, is the most common form of skin cancer. Basal cell carcinoma usually occurs on sun-damaged skin, especially in light-skinned individuals with a long history of chronic sun exposure. Bowes lines. Bowes lines are horizontal, transverse, depressions in the nail plate that run parallel to the shape of the white, moon-shaped portion of the nail bed, lunula, seen at the nail's origin. They result from a sudden interruption of nail keratin synthesis and grow distally with the nail plate. Bedbug bite. Bedbugs are small wingless parasites that come out at night to feed. They live in dry, dark crevices such as the seams of mattresses, furniture, floorboards, wallpaper, and suitcases. Their only food source is blood, and they can live for up to a year without a meal. Bedsores, pressure ulcers. Bedsores, pressure ulcers, also known as pressure sores or decubitus ulcers, result from prolonged pressure that cuts off the blood supply to the skin, causing the skin and other tissue to die. The damage may occur in as little time as 12 hours of pressure, but it might not be noticed until days later when the skin begins to break down. Biopsy, skin. A skin biopsy is a rapid and convenient office procedure that aids in the diagnosis of a patient's skin condition or lesion. Although usually done by a dermatologist, any physician who is skilled and knowledgeable with the technique and its indications can safely perform a skin biopsy. Bird flu, avian influenza H5N1, avian flu, avian influenza, or bird flu, is the name for a certain strain of the influenza virus that is usually found only in birds but may occasionally be transmitted to humans, sometimes causing a serious illness. Birthmark, congenital melanocytic nevus. Congenital melanocytic nevus, CMN, is a mole that is present at birth or shortly thereafter. It is one common type of birthmark, caused by a cluster of color, pigment, cells in the skin and sometimes in deeper tissues. Bite or sting, arthropod, insect bites. Bites or stings from insects, arthropods, are very common. Most reactions are mild and result due to an allergic reaction to either the insect or the toxins injected with the bite or sting. Bite or sting, arthropod, pediatric. Bites or stings from insects, arthropods, are very common. Most reactions are mild, and symptoms are caused by an allergic reaction to either the insect or the irritating substances, toxins, the insect makes and injects along with the bite or sting. Blepharitis. Blepharitis is inflammation of the eyelids. When it involves the outside front of the eyelid, where the eyelashes are attached, it is called anterior blepharitis. If blepharitis involves the inner eyelid, it is called posterior blepharitis. Blisters, first aid and self-care information for blisters. A blister, bulla, is caused when the outer layer of the skin separates from a layer of skin below, creating a collection of fluid between the layers. Blisters can be caused by chemical means, such as an allergic reaction, or by physical injury, such as from heat, frostbite, or friction. Blue-gray spot, Mongolian spot. Blue-gray spots, commonly referred to as Mongolian spots, are large, flat lesions that are usually found on the lower back or buttocks of infants at birth. They can occasionally be found on the legs or shoulders of infants, but this is less common. Boils, furunculosis. Boils, furuncles, are painful pus-filled bumps on the skin resulting from the deep infection of a hair follicle. The infection is usually caused by a type of bacteria called Staphylococcus aureus, staph. Botox, botulinum toxin. Aging gracefully is not desirable to some people when there are many effective and safe cosmetic procedures that can temporarily reduce a very prominent sign of aging, wrinkles. One such procedure involves the use of botulinum toxin injections. Botulinum toxin, Botox. Aging gracefully is not desirable to some people when there are many effective and safe cosmetic procedures that can temporarily reduce a very prominent sign of aging, wrinkles. One such procedure involves the use of botulinum toxin injections. Bruises, first aid and self-care information for bruises. Bruises, contusions, are dark, discolored areas on the skin that form when blood seeps into surrounding tissue beneath the skin, often due to a bump or hit to the body. Bubonic plague. Bubonic plague is an illness caused by the bacterium Yersinia pestis. This bacterium is carried by a certain type of flea, commonly known as a rat flea, which infects humans and animals. Humans can get bubonic plague from the bite of an infected flea, from the bite of an animal infected with Y. pestis, or from handling the carcass of an infected animal. Bug bite or sting. Bites or stings from insects, arthropods, are very common. Most reactions are mild and result due to an allergic reaction to either the insect or the toxins injected with the bite or sting. Bug bite or sting, pediatric, bites or stings from insects, arthropods, are very common. Most reactions are mild, and symptoms are caused by an allergic reaction to either the insect or the irritating substances, toxins, the insect makes and injects along with the bite or sting. Bug bites or stings. First aid and self-care information for bug bites or stings. Bites or stings from insects, arthropods, are very common. Most reactions are mild and result due to an allergic reaction to either the insect or the toxins injected with the bite or sting. Burns. First aid and self-care information for burns. A burn is an injury to the skin resulting from direct contact or exposure from extreme heat or cold, friction, electricity, or chemicals. First-degree burns are superficial with red skin, pain, and no blistering. Second-degree burns involve destruction of the second layer of skin, causing blistering, swelling, and pain. Third-degree burns involve destruction of all layers of the skin, including fat, muscle, blood supply, and sometimes bone. C. Café au lait macule. A café au lait macule, CAM, is a well-defined, flat area that is darker in color than the rest of the skin, hyperpigmented. The term refers to the characteristic even, homogeneous, color of coffee with milk, which may be light to dark brown. Callus. A callus, tyloma, is a thickening of the skin that occurs in response to excessive, repeated shear or friction forces, commonly due to constant rubbing of the skin. Candidiasis. Candidiasis, commonly known as a yeast infection, is an infection with the common yeast, or fungus, organism, Candida albicans, which is commonly found in the environment. Sometimes this yeast lives in the mouth, digestive, gastrointestinal, tract, and the vagina, along with many kinds of harmless bacteria, without causing any issues. Candidiasis, diaper dermatitis. Candida albicans is a type of fungus normally found in the digestive, gastrointestinal, tract. If your baby is wearing a moist or blocked up, occluded, diaper, particularly one that is dirty, has fecal contamination, an inflammatory skin rash, dermatitis, may develop on the baby's skin. Candidiasis, oral, thrush, oral candidiasis, also known as oral moniliasis, is a yeast infection of the mouth or throat, the oral cavity. The yeast that most commonly causes oral candidiasis is Candida albicans. Canker sore, aphthous ulcer. Canker sores, aphthous ulcers, or aphthy, are the most common cause of periodic, recurring, ulcers inside the mouth and genital linings, mucous membrane surfaces. Their cause is unknown, but stress, lack of sleep, trauma, and perhaps some vitamin deficiencies, toothpastes, and foods can make the condition worse. Capillaritis. Capillaritis is characterized by leakage of red blood cells from small, superficial blood vessels that results in pinpoint-like hemorrhages, petechiae. Capillaritis is frequently found in patients with long periods of extended standing related to their occupations. Cataracts. A cataract is any clouding of the human lens. This clouding can cause a reduction in vision. The lens is composed of protein and water structured to allow light to clearly pass through. Changes to the structure of the protein result in a cataract. The changes in vision associated with a cataract depend upon which part of the lens is affected. Cellulitis. Cellulitis is an infection of the skin and is most often caused by the bacteria Streptococcus or Staphylococcus. These bacteria are able to enter the skin through small cracks, fissures, causing the sudden appearance of redness, swelling, and the sensation of heat. Chapped lips, cheilitis. Chapped lips, cheilitis, are lips that appear dry, scaly, and may have one or more small cracks, fissures. Often, the lips are sensitive, and there may or may not be redness, erythema, and swelling, edema, present. Cheilitis, chapped lips, cheilitis, are lips that appear dry, scaly, and may have one or more small cracks, fissures. Often, the lips are sensitive, and there may or may not be redness, erythema, and swelling, edema, present. Cheilitis, actinic. Actinic cheilitis, sometimes known as farmer's lip or sailor's lip, is a precancerous condition related to cumulative lifetime sun exposure. The lower lip is most often affected. Individuals with actinic cheilitis often present with complaints of persistent dryness and cracking of the lips. Cheilitis, angular, perleche. Angular cheilitis, perleche, is a chronic inflammatory condition of the corners of the mouth. Usually associated with a fungal, candidal, or bacterial, staphylococcal, infection, those affected may also have thrush, oral candidiasis. Cherry hemangioma. A cherry hemangioma is a small non-cancerous, red-purple bump on the skin that is typically seen in older adults. It is formed from a proliferation of dilated small veins. Chickenpox, varicella. Chickenpox, varicella, is an infectious disease caused by the varicella zoster virus that goes away on its own. Infection spreads among humans through fluids from the airways, such as from coughing and sneezing, with non-infected household members at high risk of becoming infected as well. Chlamydial infections. Chlamydia is a common sexually transmitted disease caused by the bacterium Chlamydia trachomatis, which affects the genital tract if acquired through vaginal sex, or the mouth or anus if acquired from oral or anal sex. Chlamydia is spread through unprotected sex with an infected person. It can also be spread from an infected mother to her baby at birth. Cholera. Cholera is the name given to a diarrheal illness caused by the bacterium Vibrio cholerae. V. Cholerae is found in water or food contaminated by feces. Cholera causes profuse watery diarrhea and can lead to death by sudden dehydration because of the tremendous output of liquid stool. Chondrodermatitis nodularis helicis. Chondrodermatitis nodularis helicis is a common inflammatory condition of the ear's cartilage and overlying skin. The condition presents with very tender, small bumps, papules, or rounded lumps, nodules. Chronic migraine. Chronic migraine is defined as daily or nearly daily headaches 15 or more days per month for more than 3 months. It is also called transformed migraine or chronic daily headache by some. Additionally, the affected person has suffered at least 5 prior migraine attacks. Chronic tension headache. Chronic tension headache is a syndrome of headaches that are mild to moderate in intensity, involve tightness or pressure on both sides of the head, and are not aggravated by routine physical activity. Nausea, vomiting, and light/sound sensitivity are usually not present and, if so, are mild and infrequent. Cluster headache. Cluster headache is considered a primary headache syndrome, one of a group of headaches with distinctly different features compared to other common headache syndromes, e.g., tension headache and migraine. The hallmarks of cluster headaches are their regularity and severity. Cold sores, orofacial herpes, herpes simplex infection of the mouth and face, known as orofacial herpes simplex, herpes labialis, cold sores, or fever blisters, is a common, recurrent skin condition associated with infection by the herpes simplex virus, HSV. Common wart. Warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. Common warts are usually found on areas of the body prone to trauma, such as the elbows, knees, and hands. The virus causes thickening of the top skin layer. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Common and classical migraine. migraine is a collection of symptoms that usually includes headache as the prominent complaint. Sometimes called sick headache, weekend headache, and other names, it is very common and most people know someone who has suffered from migraines or has migraines themselves. Condyloma acuminatum, genital wart, HPV, genital warts, condyloma acuminata, are caused by the human papillomavirus, HPV, which has over 100 different strains. Subtypes number 6 and 11 cause 97% of genital warts and are considered low risk because they very rarely will cause genital or anal cancer. Conjunctivitis, pink eye, conjunctivitis, is an inflammation of the tissue on the surface of the eye and/or the inside lining of the eyelids. Contact lens solution toxicity. Contact lens solution toxicity refers to those conditions in the eye that are the result of an unwanted reaction to the use of such solutions. Corn. Corns are thickenings of the skin composed of keratin that are typically found on the toes caused by repeated friction or pressure to the area. The base of the corn is seen on the surface of the skin while the top points inward, causing discomfort. Corn, clavis. Corns are thickenings of the skin composed of keratin that are typically found on the toes caused by repeated friction or pressure to the area. The base of the corn is seen on the surface of the skin while the top points inward, causing discomfort. Corneal abrasion. A corneal abrasion is a scratch or cut, abrasion, of the clear outer layer, cornea, of the eye. Injury, trauma, is the most common cause for corneal abrasions. Corneal abrasion, first aid and self-care information for eye scratches. A corneal abrasion is a scratch or cut, abrasion, of the clear outer layer, cornea, of the eye. Injury, trauma, is the most common cause for corneal abrasions. Corneal erosion, recurrent. A recurrent corneal erosion is the recurrent breakdown of the outermost layer, epithelium, of the cornea. In recurrent corneal erosions, the outermost layer of the cornea fails to glue in tightly to its underlying membrane, basement membrane, making it possible for the epithelium to break off too easily with little effort. Corneal foreign body. A corneal foreign body occurs when the cornea has a piece of foreign matter lodged in it. The most common types of foreign bodies include particles of dust, debris, e.g., metal, wood, paint chips, and plant materials. Cradle cap. Cradle cap is the common name for seborrheic dermatitis affecting the scalp of newborns. It is a very common skin disorder affecting the oil-rich parts of the skin, including the face, ears, and scalp, and is often seen in babies up to 3 months of age. Cryosurgery. Cryosurgery uses liquid nitrogen, a very low-temperature liquid, to destroy non-cancerous, benign, and some cancerous, malignant, skin lesions. It is a common treatment option because of its low cost, ease of use, and effectiveness. When used by properly trained and experienced physicians, cryosurgery can remove a lesion with good cosmetic results. Culture, microbiological. A microbiological culture is a method of obtaining tissue or fluid from a suspected site of infection. Taking into account the clinical scenario, the results can confirm the presence or absence of an infection. Types of infections detected include bacterial, viral, and fungal. Curettage. Curettage, in dermatology, is a surgical procedure that uses a curette, a small scoop-shaped instrument, to scrape off non-cancerous skin growths and certain skin cancers such as basal cell carcinomas, viral warts, and non-cancerous lesions smaller than 1 cm, and seborrheic keratosis. Cutaneous horn. A cutaneous horn, also known as cornucutaneum, refers to a specific appearance of a skin lesion in which a cone-shaped protuberance arises on the skin caused by overgrowth of the most superficial layer of skin, epidermis. A cutaneous horn is not a particular lesion but is a reaction pattern of the skin. Cutis rhomboidalis nuclei. Cutis rhomboidalis nuclei refers to the manifestation of long-term, prolonged sun exposure and resultant damage to the skin occurring on the back of the neck. Long-term, chronic sun exposure causes thickening of the most superficial layer of the skin, the epidermis, and abnormalities in the composition of the middle layer of the skin, the dermis. Cyst, epidermoid, sebaceous cyst, Epidermoid cysts, sometimes known as sebaceous cysts, contain a soft cheesy material composed of keratin, a protein component of skin, hair, and nails. Epidermoid cysts form when the top layer of skin, epidermis, grows into the middle layer of the skin, dermis. Cyst, myxoid, a myxoid cyst, also known as a digital mucus cyst or pseudocyst, is a growth usually occurring on the finger. The cysts are believed to form from deteriorated issues. Dandruff, also known as seborrhea, is a common non-contagious condition of skin areas rich in oil glands, the face, scalp, and upper trunk, marked by flaking, overproduction of skin cells, and sometimes redness and itching, inflammation, of the scalp, varying in severity from mild flaking of the scalp to scaly, red patches. Dengue fever is a viral illness passed to humans through the bite of an infected mosquito. The disease is rare in the United States, with perhaps 200 cases occurring every year, but it is common worldwide, with up to 100,000 cases a year. The mosquitoes that carry the dengue fever virus, a member of the Flavivirus family, live in tropical areas, and they tend to bite humans during the day. Dermatitis, atopic, eczema, atopic dermatitis, is a disorder associated with dry skin, which begins with intense itching that is aggravated by scratching. The exact cause of eczema is unknown, and there is no known cure. Dermatitis, contact, allergic contact dermatitis is a delayed hypersensitivity reaction. The reaction to the allergen occurs 48-72 hours after exposure. The most common allergens causing allergic contact dermatitis appear to be nickel, chromates, rubber chemicals, and neomycin, an antibacterial. Dermatitis, contact, pediatric, allergic contact dermatitis is an allergy to a substance, the allergen, touching the skin. The reaction occurs 48-72 hours after exposure. Common allergens are nickel, chromates, rubber chemicals, and neomycin, an antibacterial medication. Dermatitis, diaper irritant, diaper rash, irritant diaper dermatitis, occurs when an infant's sensitive skin is exposed to urine and stool, coupled with the diaper rubbing and chafing the skin, a tight-fitting diaper, or possible a diaper being left on too long. A diarrheal illness can bring on or worsen the condition. Dermatitis, dyshydrotic eczema, dyshydrotic dermatitis, is generally defined as a rash limited to the hands, usually the palms and sides of the fingers, and sometimes the feet. Dyshydrotic eczema manifests as small, itchy, fluid-filled blisters. Dermatitis, irritant contact dermatitis is an inflammatory rash caused by direct chemical injury to the skin. Unlike allergic contact dermatitis, which appears 48-72 hours after exposure to an allergen, the symptoms of irritant contact dermatitis can result within a few hours if the exposure is a strong irritant. Dermatitis, nipple dermatitis describes either itchiness or soreness of either one or both nipples. There are several possible causes of this problem, including eczema, atopic dermatitis, thrush, a yeast infection, an allergic reaction, contact dermatitis, or a local irritation. Dermatitis, nummular dermatitis is a particular form of eczema, atopic dermatitis, characterized by coin-shaped, raised areas on the skin that are scaly. The cause of nummular dermatitis is not known, but it is associated with triggers such as frequent bathing, irritating and drying soaps, and exposure to irritating fabrics such as wool. Dermatitis, perioral dermatitis is an acne-like condition of unknown cause. Some possible causes are the use of topical corticosteroid creams, cosmetic products, oral contraceptives, fluoride and anti-tartar ingredients in dental products, and it tends to occur in those prone to eczema. Dermatitis, perioral of childhood. Perioral dermatitis is an acne-like problem commonly seen around the mouth in children. Children are otherwise well, but they develop small pink bumps around the mouth and sometimes around the nose and eyes. Dermatitis, poison ivy, oak, sumac. Poison ivy, poison oak, or poison sumac dermatitis are a reaction to the Rus antigen, which is found in poison ivy, poison oak, and poison sumac plants. Dermatitis, seborrheic. Seborrheic dermatitis, also known as seborrhea, is a common non-contagious condition of skin areas rich in oil glands, the face, scalp, and upper trunk. Seborrheic dermatitis is marked by flaking, overproduction of skin cells, and sometimes redness and itching, inflammation, of the skin, and it varies in severity from mild dandruff of the scalp to scaly, red patches on the skin. Dermatitis, seborrheic, pediatric. Seborrheic dermatitis in infants is a common non-contagious condition of skin areas rich in oil glands, e.g., the face, scalp, and upper trunk. Seborrheic dermatitis is marked by overproduction of skin cells, leading to flaking, and sometimes inflammation, leading to redness and itching. It varies in severity from mild dandruff of the scalp to scaly, red patches on the skin. Dermatitis, stasis. Dermatitis is a term used to describe irritation of the skin with scaling, rough or dry skin, redness, itching, and sometimes oozing, crusts, and erosions. Stasis is a term used to describe leg swelling seen in conditions of poor circulation and fluid buildup. Dermatofibroma, dermatofibromas, or histiocytomas, are common non-cancerous, benign, skin growths. They are firm to hard, and they are skin-colored or slightly pigmented. Dermatosis papulosa nigra. Dermatosis papulosa nigra is a harmless condition commonly affecting the faces of Black and sometimes Asian adults. The cause of dermatosis papulosa nigra is unknown, although about half of people affected have a family history of the disease. Diabetic dermopathy. Diabetic dermopathy, also known as shin spots or pigmented pretibial patches, is a skin condition usually found on the lower legs of people with diabetes. It is thought to result from changes in the small blood vessels that supply the skin and from minor leakage of blood products from these vessels into the skin. Diabetic ulcer, neurogenic ulcer. Neurogenic ulcers, also known as diabetic ulcers, are ulcers that occur most commonly on the bottom of the foot. People with diabetes are predisposed to peripheral neuropathy, which involves a decreased or total lack of sensation in the feet. Diaper dermatitis, candidiasis. Candida albicans is a type of fungus normally found in the digestive, gastrointestinal, tract. If your baby is wearing a moist or blocked up, occluded, diaper, particularly one that is dirty, has fecal contamination, an inflammatory skin rash, dermatitis, may develop on the baby's skin. Diaper rash, irritant diaper dermatitis. Diaper rash, irritant diaper dermatitis, occurs when an infant's sensitive skin is exposed to urine and stool, coupled with the diaper rubbing and chafing the skin, a tight-fitting diaper, or possible a diaper being left on too long. A diarrheal illness can bring on or worsen the condition. Discoid lupus erythematosus. Lupus is a disease in which your body's self-protection mechanism, immune system, attacks your own body rather than a foreign invader. The cause of lupus is unknown, and the disease usually takes one of two forms: systemic lupus erythematosus, SLE, which can affect any body organ, and discoid lupus erythematosus, DLE, which is milder and usually affects only the skin. Drug eruption, a drug rash. Drug eruption, also known as a drug reaction, is a skin condition caused by a medication. A drug rash can appear in many forms, and any medication can cause a drug rash. Drug eruption, pediatric. A drug eruption, also known as drug reaction or drug rash, is a skin condition caused by taking a drug, medication. A drug eruption can appear in many ways, and any medication can cause a drug eruption. Dry skin, xerosis. Dry skin, xerosis, is a condition of rough, dry skin with fine scaling of skin and, occasionally, with small cracks in the skin. Dry skin is also known as winter itch or astiotosis. Dyshydrotic eczema, dyshydrotic dermatitis. Dyshydrotic eczema, dyshydrotic dermatitis, is generally defined as a rash limited to the hands, usually the palms and sides of the fingers, and sometimes the feet. Dyshydrotic eczema manifests as small, itchy, fluid-filled blisters. E. coli, Escherichia coli, more commonly known as E. coli, is a group of bacteria that populate the human, and animal, gut. E. coli is usually thought of as a good bacterium. It lives in the intestines as part of the normal gut flora. However, some strains of E. coli can cause very serious illness. Eczema, atopic dermatitis. Eczema, atopic dermatitis, is a disorder associated with dry skin, which begins with intense itching that is aggravated by scratching. The exact cause of eczema is unknown, and there is no known cure. Electrodesiccation. Electrodesiccation is a fast and simple office-based procedure that uses electric current delivered via a needle-shaped electrode to superheat the skin in pinpoint precise areas. Epidermoid cyst. Epidermoid cysts, sometimes known as sebaceous cysts, contain a soft cheesy material composed of keratin, a protein component of skin, hair, and nails. Epidermoid cysts form when the top layer of skin, epidermis, grows into the middle layer of the skin, dermis. Erythema infectiosum, fifth disease. Fifth disease, erythema infectiosum, also called slapped cheek disease, is a common illness in young children due to infection with parvovirus B19. Fifth disease is spread by contact with others who are infected, by exposure to fluid from the nose, respiratory secretions. Erythema nodosum. Erythema nodosum is a skin condition characterized by the sudden eruption of tender, red bumps, particularly on the shins. It represents inflammation of the deeper portions of the skin, the adipose tissue, or fatty layer of skin. Erythema toxicum neonatorum. Erythema toxicum, also known as toxic erythema of the newborn, is a harmless red rash that appears on the skin of newborns, goes away on its own and has no symptoms. It has often been likened to the appearance of a flea bite on the skin. It is an extremely common rash that does not require any treatment. Erythrasma. Erythrasma is a common chronic skin condition affecting the skin folds. The slowly enlarging patches of pink to brown dry skin are caused by an infection by the bacterium Corynebacterium minutissimum. Ethnic skin, cosmetic procedures. Ethnic skin is a term used to indicate a person with olive or darker skin who tans easily. Patients with dark skin often display fewer signs of aging than similarly sun-exposed whites and, therefore, may require a different approach. Medical advances in dermatology have made it possible for people with darker skin types to benefit from many cosmetic procedures that were formerly only available to lighter-skinned patients. Excessive sweating, hyperhidrosis. Hyperhidrosis, the medical name for excessive sweating, is manifested by excessive sweating, usually of a defined body part, including the palms, soles, forehead, or underarms. Rarely, hyperhidrosis can be generalized, affecting the majority of the skin. Eye scratch, corneal abrasion, first aid and self-care information for eye scratches. A corneal abrasion is a scratch or cut, abrasion, of the clear outer layer, cornea, of the eye. Injury, trauma, is the most common cause for corneal abrasions. Fainting, first aid and self-care information for fainting. Fainting is a form of unconsciousness that is quick and brief, often due to low blood sugar or standing in one place for too long. Fainting can also be caused by a more serious medical matter. Unconsciousness is an abnormal state in which a person is not alert and not fully responsive to his/her surroundings. Fibrous papule of nose. A fibrous papule of the nose is a harmless, small, raised pimple-like growth, papule, on the nose or central face that feels firm to the touch and is skin-colored or pink. There is usually a single papule, but you may have multiple papules. Fifth disease, erythema infectiosum. Fifth disease, erythema infectiosum, also called slapped cheek disease, is a common illness in young children due to infection with parvovirus B19. Fifth disease is spread by contact with others who are infected, by exposure to fluid from the nose, respiratory secretions. Flashes and floaters. Flashes and floaters describes a condition that comes from changes in the back chamber of the eye, the posterior chamber, also known as the vitreous cavity. Flat wart. Warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. The virus causes thickening of the top skin layer. Flat warts tend to stay small in size but can be numerous in quantity. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Flea bite. Fleas most often bite people around the legs and the ankles. The resulting red bump is an allergic reaction to flea saliva. The bites, which are usually but not always felt immediately, become increasingly irritated and may remain sore and or itchy for as long as a week. Folliculitis. Folliculitis is a skin condition caused by an inflammation of one or more hair follicles in a limited area. It typically occurs in areas of irritation, such as sites of shaving, skin friction, or rubbing from clothes. In most cases of folliculitis, the inflamed follicles are infected with bacteria, especially with Staphylococcus organisms, that normally live on the skin. Folliculitis, Pseudomonas, hot tub folliculitis, hot tub rash, Pseudomonas folliculitis, is an infection of the hair follicle with Pseudomonas bacteria. It is most commonly seen in people who bathe in a contaminated spa, swimming pool, or hot tub. Foodborne illness, food poisoning, first aid and self-care information for food poisoning. Most foodborne illness, also known as food poisoning, comes from bacteria in food that has multiplied, either from poor handling, improper cooking, or poor storage of food. Other things, such as toxins, parasites, chemicals, and viruses, can contaminate food, but these causes are much less common than contamination from bacteria. Fordyce spots. Fordyce spots are normal large, superficial sebaceous, oil-producing glands seen on the moist tissue that lines some organs and body cavities, mucosal surfaces. The spots are asymptomatic and can be found on the head of the penis, the inner foreskin, and, most commonly, at the border of the lips. Foreign object in eye or skin. First aid and self-care information for an object in the eye or skin. A foreign object can become embedded in the skin or eye, and any movement of the object, including removing it, can cause increased bleeding, damage, or pain. Frostbite. First aid and self-care information for frostbite. Frostbite is freezing of the skin that occurs due to exposure to cold temperatures. Frostbite often starts out with mild symptoms and can progress and become quite severe and even limb-threatening. Furunculosis, boil, furuncle, boils, furuncles, are painful pus-filled bumps on the skin resulting from the deep infection of a hair follicle. The infection is usually caused by a type of bacteria called Staphylococcus aureus, staph. Genital herpes. Genital herpes is a recurrent, lifelong skin infection caused by the herpes simplex virus, HSV. There are 2 types of HSV, herpes simplex virus type 1, HSV1, and herpes simplex virus type 2, HSV2. Genital herpes is usually caused by HSV2 but can occasionally be due to HSV1. Genital wart, Condyloma acuminatum. Genital warts, Condyloma acuminata, are caused by the human papillomavirus, HPV, which has over 100 different strains. Subtypes number 6 and 11 cause 97% of genital warts and are considered low risk because they very rarely will cause genital or anal cancer. German measles, rubella. German measles, rubella, is caused by the rubella virus and spreads among humans through contact with fluids in the respiratory tract. The development, incubation, period of German measles is 14-21 days before starting to feel ill, and a rash accompanied by fever appears 1-7 days later. Gonorrhea, primary infection. Gonorrhea is a sexually transmitted disease caused by the bacterium Neisseria gonorrhea. It is a contagious sexually transmitted disease spread by unprotected oral, vaginal, or anal sex with an infected partner. The bacterium can live in the mouth, semen, or vaginal fluids of infected persons. It is possible to be infected without symptoms and continue to spread the disease. Gout, also called gouty arthritis, is a disease of how the body processes nutrients, metabolism, in which crystals of uric acid are deposited in the joints, tendons, and skin. Most commonly affecting men, gout emerges as the sudden development of swollen, red, hot, tender joints, especially at the big, great, toe, ankle, wrist, and knee. Granuloma, pyogenic. Pyogenic granuloma is a common, benign growth that often appears as a rapidly growing, bleeding bump on the skin or inside the mouth. It is composed of blood vessels and may occur at the site of minor injury. Granuloma annulari. Granuloma annulari is a common skin condition characterized by bumps appearing over the joints and the backs of the hands. Its cause is not known, and most episodes of granuloma annulari clear up after a few years, with or without treatment. Hair loss, alopecia areata. Alopecia areata is an autoimmune condition resulting in hair loss. The immune system of the body mistakenly stops hair growth for unknown reasons. Hair loss, female pattern baldness, female pattern alopecia, female pattern baldness, alopecia, is a form of hair loss affecting women due to an inherited susceptibility. It is most commonly noticed after menopause, although it may begin earlier. Hair loss, male pattern baldness, male pattern alopecia, male pattern baldness, alopecia, or androgenetic alopecia, is the patterned balding of a man. Although the condition may affect both the appearance and self-esteem of some men, one should note that the condition is not a medical disorder. Hair removal, laser, with just the right type of laser or intense pulsed light, IPL, technology, suitable hairs can be superheated and permanently removed. The target of the light is the pigment in the hair. The ideal candidate is a patient with fair skin and dark, coarse hair. Hairy tongue, also known as black tongue, is a benign condition of elongation and staining of the finger-like projections, papillae, on the tongue surface. This condition may be caused by overgrowth of a bacteria or yeast that produces a colored substance, pigment. Hand, foot and mouth disease. Hand, foot and mouth disease is a suddenly appearing, acute, self-limited viral disease caused by viruses of the enterovirus group, particularly Coxsackie-virus A16. The development, incubation, period from infection to symptoms is short, from 3–6 days. Head lice, pediculosis capitis. Head lice, pediculosis capitis, are highly contagious, and the most prominent symptom of a head lice infestation includes intense scalp itching. The human head louse is a tiny insect that feeds on human blood. The female louse lays eggs, nits, on the hair shaft close to the scalp, and they become glued to the hair shaft. Head trauma, first aid and self-care information for head trauma. Injuries to the head can involve any or all parts of the head, the scalp, skull, brain, spinal fluid, and blood vessels. Head trauma can be internal or external, or both. External injuries can cause a fractured skull. An internal injury, such as the brain hitting the inside of the skull, can cause bleeding within the skull. Headache, tension headache. Tension headache involves intermittent episodes of head discomfort that are mild to moderate in intensity, include non-throbbing tightness or pressure, generally on both sides of the head, and are not aggravated by routine physical activity. Nausea, vomiting, and light/sound sensitivity are rarely present. Heat cramps, first aid and self-care information for heat cramps. Heat cramps are a form of heat illness. Heat illness occurs when a person's core body temperature rises above a safe level of the body's internal temperature range. Heat cramps are the earliest sign of heat illness. Loss of salt in the body due to excessive perspiring causes the painful, involuntary muscle spasms. If the person does not take precautions to cool off and rehydrate at this point, more severe stages of heat illness will occur. Heat exhaustion, first aid and self-care information for heat exhaustion. Heat exhaustion is the moderate form of heat illness. Heat illness occurs when a person's core body temperature rises above a safe level of the body's internal temperature range. Heat cramps are the earliest sign of heat illness. If precautions to cool off and rehydrate at this point are not made, the more severe stage of heat illness, heat exhaustion, can occur. The progression from the early stage of heat illness to heat exhaustion can be very quick. Heat rash or prickly heat, miliaria rubra. Heat rash, miliaria rubra, also known as prickly heat, is a rash of small red bumps caused by blockage of the sweat glands. It can be due to high fever, excessive sweating, or being overbundled. It is commonly seen in hot, humid tropical climates. It can cause discomfort, itching, and, sometimes, stinging or prickly type pain. Heat stroke, first aid and self-care information for heat stroke. Heat stroke, also known as sunstroke, is a form of heat illness. Heat illness occurs when a person's core body temperature rises above a safe level of the body's internal temperature range. Heat cramps are the earliest sign of heat illness. If precautions to cool off and rehydrate at this point are not made, the more severe stage of heat illness, heat exhaustion, can occur. The most severe form of heat illness is heat stroke, which may result in shock, brain damage, or death. Hemangioma, infantile. Hemangiomas are harmless tumors that are the result of rapidly dividing cells of the blood vessel walls, known as endothelial cells. They are present at birth or shortly after and grow rapidly during the first year of life. They usually resolve on their own over the next few years. Herpes simplex virus, HSV. The first eruption of skin or mouth sores with the herpes simplex virus, HSV, is called primary herpes. This may be more severe than the more commonly recognized than secondary, or recurrent, herpes infections, which are also called cold sores or fever blisters. Herpes simplex virus, HSV, genital herpes is a recurrent, lifelong skin infection caused by the herpes simplex virus, HSV. There are two types of HSV, herpes simplex virus type 1, HSV1, and herpes simplex virus type 2, HSV2. Genital herpes is usually caused by HSV2 but can occasionally be due to HSV1. Herpes simplex virus, HSV, orofacial, herpes simplex infection of the mouth and face, known as orofacial herpes simplex, herpes labialis, cold sores, or fever blisters, is a common, recurrent skin condition associated with infection by the herpes simplex virus, HSV. Herpes simplex virus, HSV, sacral, herpes simplex infection of the lower back and buttocks also called sacral herpes simplex or genital herpes is a common, recurrent skin condition associated with infection by the herpes simplex virus, HSV. HSV infection usually appears as small blisters or sores around the mouth, nose, genitals, buttocks, and lower back, though infections can develop almost anywhere on the skin. Herpetic whitlow, also called digital herpes simplex, finger herpes, or hand herpes is a painful viral infection occurring on the fingers or around the fingernails. Herpetic whitlow is caused by infection with the herpes simplex virus, HSV. Hidradenitis suppurativa. Hidradenitis suppurativa is a chronic condition of the sweat glands. The sweat glands become clogged due to a variety of reasons, leading to enlargement, dilatation, of the ducts behind them. This dilatation predisposes the area to inflammation and infection by a variety of bacteria. Hives, urticaria, also known as welts, is a common skin condition with an itchy rash of pink to red bumps that appear and disappear anywhere on the body. An individual lesion of hives typically lasts a few hours before fading away, and new hives can appear as older areas disappear. Hordeolum, stye, and chalazion, a stye, hordeolum, is a local, acutely inflamed growth, swelling, lesion, of the eyelid. They can occur at the lid margin or farther up the lid on either the inner, tarsal, side or the outer, skin, side of the lid. A chalazion is the chronic form of a stye, and its cellular makeup is different than that of a stye. Hot tub rash, Pseudomonas folliculitis. Hot tub rash, Pseudomonas folliculitis, is an infection of the hair follicle with Pseudomonas bacteria. It is most commonly seen in people who bathe in a contaminated spa, swimming pool, or hot tub. Human immunodeficiency virus, HIV, primary infection. Primary HIV infection, FI syndrome is an acute, flu-like illness that develops anywhere from 1 to 6 weeks following exposure to HIV, the human immunodeficiency virus. Hyperhidrosis. Hyperhidrosis, the medical name for excessive sweating, is manifested by excessive sweating, usually of a defined body part, including the palms, soles, forehead, or underarms. Rarely, hyperhidrosis can be generalized, affecting the majority of the skin. Hyperpigmentation, post-inflammatory. Post-inflammatory hyperpigmentation is darkening of the skin in an area of prior injury or skin disorder from increased pigment, melanin, left from the healing process. Sometimes the darkening may also be due to an iron pigment left behind when old red blood cells die. Hypopigmentation, post-inflammatory. Post-inflammatory hypopigmentation is a loss of skin color, pigmentation, after your skin heals from an injury. The pigment-producing cells, melanocytes, are damaged or destroyed in the healing process. Hypothermia, first aid and self-care information for hypothermia. Hypothermia is when a person's internal body temperature drops below normal due to cold exposure. While hypothermia typically occurs outdoors, it can also occur indoors because there are many things that can make a person lose body heat. Ichthyosis vulgaris. Ichthyosis vulgaris, also known as common ichthyosis or fish scale disease, is a skin condition resulting in scaly skin, especially on the arms and legs. Its name is derived from the Greek word meaning fish. Impetigo. Impetigo is a common and contagious bacterial skin infection that is usually a minor problem, but sometimes complications may occur that require treatment. Complications related to impetigo can include deeper skin infection, cellulitis, meningitis, or a kidney inflammation, post-streptococcal glomerulonephritis, which is not prevented by treatment. Intertrigo. Intertrigo is irritation of touching skin surfaces in body fold regions, armpits, under the breasts, belly, buttocks, groin, and sometimes between fingers or toes. Intertrigo can be worsened by any conditions causing increased heat, wetness, and friction. Irritant contact dermatitis. Irritant contact dermatitis is an inflammatory rash caused by direct chemical injury to the skin. Unlike allergic contact dermatitis, which appears 48–72 hours after exposure to an allergen, the symptoms of irritant contact dermatitis can result within a few hours if the exposure is a strong irritant. Jellyfish stings. First aid and self-care information for jellyfish stings. Jellyfish are aquatic invertebrates that can sting people who come into direct contact with them. The stingers, which are typically located on the ends of the jellyfish tentacles, contain poisons that are often toxic to humans. Jock itch, tinea cruris. Jock itch, tinea cruris, is a surface, superficial, fungal infection of the skin on either side of the body where the thigh joins the abdomen, known as the groin. It is often spread to the groin from tinea infection on the feet, tinea pedis or athlete's feet. Juvenile plantar dermatosis, sweaty sock syndrome. Juvenile plantar dermatosis is a condition where the skin becomes scaly and red on the soles of the feet of children and young teenagers. The cause of sweaty sock syndrome is unknown, though alternating moist and dry conditions may lead to the condition. Keloid. Keloids are dense, thick nodules, typically found at areas of previously injured skin, burns, lacerations, or they may arise spontaneously on normal skin. They may be single or multiple. Keratoacanthoma. Keratoacanthoma, KA, is a rapidly growing skin cancer usually appearing as a volcano-like bump on the sun-exposed skin of middle-aged and elderly individuals. Many scientists consider keratoacanthoma to be a less serious form of squamous cell carcinoma. Keratolysis, pitted. Pitted keratolysis is a skin condition affecting the soles of the feet and, less commonly, the palms of the hands. It is caused by a bacterial infection of the skin and may give off an unpleasant odor. Keratosis, seborrheic. Seborrheic keratoses are common benign growths of unknown cause seen in adults due to a thickening of an area of the top skin layer. Keratosis pilaris. Keratosis pilaris is a very common benign skin condition appearing as small, whitish bumps on the upper arms and thighs, especially of children and young adults. Individual lesions of keratosis pilaris arise when a hair follicle becomes plugged with keratin, a protein found in skin, hair, and nails. Carrion. Carrion is a scalp condition that occurs in severe cases of tinea capitis, or scalp ringworm. Carrion appears as an inflamed, thickened, pus-filled area, and it is sometimes accompanied by a fever. Legionellosis, Legionnaire's disease. Legionellosis is the name for infection caused by the Legionella pneumophila bacterium. Infection can take two forms, the more serious Legionnaire's disease, which is a pneumonia, and the less serious Pontiac fever. Lentigo, solar, a solar lentigo, plural, solar lentigines, also known as a sun-induced freckle or senile lentigo, is a dark, hyperpigmented, lesion caused by natural or artificial ultraviolet, UV, light. Solar lentigines may be single or multiple. This type of lentigo is different from a simple lentigo, lentigo simplex, because it is caused by exposure to UV light. Lentigo simplex is a type of color-containing, pigmented, lesion not caused by sun exposure, which looks like the freckle-like condition, lentigo, caused by sun exposure, solar lentigo. In both conditions, an increased number of pigment-producing cells, melanocytes, are present. Lichen planus, LP, is a disease of the skin and, less often, the scalp, fingernails, toenails, and or inside the mouth or genitalia, mucous membranes. Lichen planus can resolve on its own without treatment or be chronic, even with aggressive treatment. The cause of the inflammation that leads to lichen planus is unknown. Lichen simplex chronicus, LSC, also known as neurodermatitis circumscripta, is an itchy skin condition causing thickened skin at the areas of skin injured by repeated scratching and rubbing. Lichen simplex chronicus is not a primary disease but rather the skin's response to chronic physical injury, trauma. Linea nigra is a dark vertical line that appears on the belly during pregnancy. It can extend from the top of the belly to the pubic area, running through the center of the belly button, or the line can be shorter. Increased hormones present during pregnancy stimulate increased pigment production, causing this area to darken. Lupus erythematosus, discoid. Lupus is a disease in which your body's self-protection mechanism, immune system, attacks your own body rather than a foreign invader. The cause of lupus is unknown, and the disease usually takes one of two forms: systemic lupus erythematosus, SLE, which can affect any body organ, and discoid lupus erythematosus, DLE, which is milder and usually affects only the skin. Lupus erythematosus, systemic lupus erythematosus, SLE, also called lupus, is a chronic inflammatory disease that can affect almost any part of the body, especially the skin, joints, kidneys, heart, lungs, bones, blood, or brain. Systemic lupus erythematosus is considered an autoimmune disorder, meaning that a person's own immune system attacks his or her own healthy cells and tissues, causing inflammation and damage. Lyme disease is the result of infection with the bacteria Borrelia burgdorferi. The disease is transmitted by infected ticks that also feed on mice and deer. The tick can be found attached to the skin in many cases. Most cases of Lyme disease occur in the spring and summer months. Lymphogranuloma venereum, LGV. Lymphogranuloma venereum, LGV, is an uncommon sexually transmitted disease caused by certain types of the bacteria called Chlamydia trachomatis. It is spread through having unprotected vaginal, oral, or anal sex. Measles, rubiola. Measles, rubiola, is a highly contagious infection of the respiratory system, which is caused by a virus. It does not occur often in the United States, since immunizations have been required since the 1960s. Medication overuse headache. Medication overuse headache is a chronic headache syndrome with three core criteria. The use of a medication meant to terminate headache is beyond a critical dose and duration, which is specific to the type of medication in question. the majority of days are notable for persistent headache. There is no other medical explanation for the headaches. Melanoma, skin cancer, is the most common cancer in the United States, and it is the sixth most common cause of cancer death in the United States. Melanoma is the least common of the skin cancers. The other types are squamous cell and basal cell carcinoma, but it is the most serious. Melanotic macule, oral melanotic macule is a non-cancerous, benign, dark spot found on the lips or inside the mouth. An oral melanotic macule found on the lip is sometimes called a labial melanotic macule. Melasma is a non-cancerous, benign, disorder of unknown cause that causes dark, hyperpigmented, patches, primarily on the face. The condition is marked by brown patches that worsen in response to increases of the hormone estrogen, such as during pregnancy or with the use of birth control pills. Migraine, chronic migraine is defined as daily or nearly daily headaches 15 or more days per month for more than 3 months. It is also called transformed migraine or chronic daily headache by some. Additionally, the affected person has suffered at least 5 prior migraine attacks. Migraine, common and classical. Migraine is a collection of symptoms that usually includes headache as the prominent complaint. Sometimes called sick headache, weekend headache, and other names, it is very common and most people know someone who has suffered from migraines or has migraines themselves. Milia are a common skin finding in people of all ages. They are formed when dead skin does not slough off normally but instead remains trapped in a tiny, round pocket on the surface of the skin. An individual milium, the singular if milia, is formed at the base of a hair follicle or sweat gland. Miliaria rubra, heat rash. Miliaria rubra, also known as prickly heat, is a rash of small red bumps caused by blockage of the sweat glands. It can be due to high fever, excessive sweating, or being overbundled. It is commonly seen in hot, humid tropical climates. It can cause discomfort, itching, and, sometimes, stinging or prickly type pain. Mohs micrographic surgery. Mohs surgery is a technique used in the treatment of several skin cancers that allows for complete removal of the lesion while minimizing removal of otherwise normal adjacent skin. Mole, nevus, a mole, nevus, is a non-cancerous, benign, skin lesion that is made up of the color-producing, pigment-producing, cells of the skin, melanocytes. A mole that is present at birth is referred to as a congenital nevus, mole, atypical nevus, atypical moles, atypical nevi, or dysplastic moles, dysplastic nevi, are caused by collections of the color-producing, pigment-producing, cells of the skin, melanocytes, in which the cells grow in an abnormal way. Atypical moles may occur as new lesions or as a change in an existing mole. Molluscum contagiosum. Molluscum is a common painless and usually harmless viral infection of the skin. Although it is painless and usually goes away after several months, some cases can last a few years. Molluscum contagiosum, pediatric. Molluscum contagiosum is a common viral infection of the skin that resolves on its own, usually within a few months. It is caused by the pox virus and affects only humans. It can spread to other areas of the skin by scratching or rubbing and can be transmitted to other people by skin-to-skin contact or handling contaminated objects such as towels, toys, and clothing. Mongolian spot, blue-gray spot. Blue-gray spots, commonly referred to as Mongolian spots, are large, flat lesions that are usually found on the lower back or buttocks of infants at birth. They can occasionally be found on the legs or shoulders of infants, but this is less common. Mucocele, oral. An oral mucocele is a harmless, fluid-containing, cyst-like, swelling of the lip or mouth lining, mucosa, due to mucus from the small salivary glands of the mouth leaking into the soft tissue, usually from injury, trauma, or blockage of the gland. Myxoid cyst. A myxoid cyst, also known as a digital mucus cyst or pseudocyst, is a growth usually occurring on the finger. The cysts are believed to form from deteriorated issues. Nail infection, bacterial, Peyroniecia, commonly known as bacterial nail infection, is inflammation of the region of the finger or toe from which the nail plate originates, which is called the proximal nail fold, PNF. This inflammation may occur in the short term, acute, or may be a long-term problem or one that keeps coming back, chronic. Nail infection, fungal, onychomycosis, commonly known as a fungal nail infection, is infection of the fingernails or toenails by forms of fungi and yeast. Fungal nail infections account for nearly half of all nail disorders. Nail lifting, onycholysis, is the spontaneous separation, detachment, of the fingernail or toenail from the nail bed at the end of the nail, distal, and / or on the sides of the nail, lateral. The appearance of nail lifting may resemble a half moon, or the free edge of the nail may rise up like a hood. Nail splitting, onychoschitzia, commonly known as nail splitting but also known as onychoschisis or lamellar dystrophy, is a condition that causes horizontal splits within the nail plate. Nail splitting is often seen together with onychorexis longwise, longitudinal, splitting or ridging of the nail plate, and these two diseases together are called brittle nail syndrome. Neurogenic ulcer, diabetic ulcer, neurogenic ulcers, also known as diabetic ulcers, are ulcers that occur most commonly on the bottom of the foot. People with diabetes are predisposed to peripheral neuropathy, which involves a decreased or total lack of sensation in the feet. Nevus, atypical moles, atypical nevi, or dysplastic moles, dysplastic nevi, are caused by collections of the color-producing, pigment-producing, cells of the skin, melanocytes, in which the cells grow in an abnormal way. Atypical moles may occur as new lesions or as a change in an existing mole. Nevus, common acquired, mole, nevus, a mole, nevus, is a non-cancerous, benign, skin lesion that is made up of the color-producing, pigment-producing, cells of the skin, melanocytes. A mole that is present at birth is referred to as a congenital nevus, congenital melanocytic nevus, CMN, is a mole that is present at birth or shortly thereafter. It is one common type of birthmark, caused by a cluster of color, pigment, cells in the skin and sometimes in deeper tissues. Nipple dermatitis. Nipple dermatitis describes either itchiness or soreness of either one or both nipples. There are several possible causes of this problem, including eczema, atopic dermatitis, thrush, a yeast infection, an allergic reaction, contact dermatitis, or a local irritation. Nosebleed, first aid and self-care information for a nosebleed. Nosebleeds either occur spontaneously or are the result of some sort of trauma, such as a hit to the face. Things that cause nosebleeds are certain medical conditions, e.g., colds, allergies, high blood pressure, and bleeding abnormalities such as hemophilia or von Willebrand disease, extreme cold and / or dry air, nose picking, strenuous activity, certain medications, e.g., nasal sprays, and being hit in the nose. Notalgia paresthetica. Notalgia paresthetica is a condition where the skin of the upper back becomes itchy, and there is often a darker patch of skin on the itchy area. Notalgia paresthetica may be caused by a problem with the nerve cells that provide feeling to the skin of the upper back, sensory neuropathy. Nummular dermatitis. Nummular dermatitis is a particular form of eczema, atopic dermatitis, characterized by coin-shaped, raised areas on the skin that are scaly. The cause of nummular dermatitis is not known, but it is associated with triggers such as frequent bathing, irritating and drying soaps, and exposure to irritating fabrics such as wool. Object in eye or skin, first aid and self-care information for an object in the eye or skin. A foreign object can become embedded in the skin or eye, and any movement of the object, including removing it, can cause increased bleeding, damage, or pain. Onycholysis, nail lifting. Onycholysis is the spontaneous separation, detachment, of the fingernail or toenail from the nail bed at the end of the nail, distal, and / or on the sides of the nail, lateral. The appearance of nail lifting may resemble a half moon, or the free edge of the nail may rise up like a hood. Onychomycosis. Onychomycosis, commonly known as a fungal nail infection, is infection of the fingernails or toenails by forms of fungi and yeast. Fungal nail infections account for nearly half of all nail disorders. Onychoschitzia. Onychoschitzia, commonly known as nail splitting but also known as onychoschisis or lamellar dystrophy, is a condition that causes horizontal splits within the nail plate. Nail splitting is often seen together with onychorexis longwise, longitudinal, splitting or ridging of the nail plate, and these two diseases together are called brittle nail syndrome. Oral melanotic macule. Oral melanotic macule is a non-cancerous, benign, dark spot found on the lips or inside the mouth. An oral melanotic macule found on the lip is sometimes called a labial melanotic macule. Oral mucocele. An oral mucocele is a harmless, fluid-containing, cyst-like, swelling of the lip or mouth lining, mucosa, due to mucus from the small salivary glands of the mouth leaking into the soft tissue, usually from injury, trauma, or blockage of the gland. Pup, pruritic urticarial papules. Plagues of pregnancy. Pruritic urticarial papules and plagues of pregnancy, PUP, is the most common skin condition of pregnancy. Typically, women affected by PUP develop red, itchy bumps on the belly near stretch marks, striae, during their third trimester. Pyronychia. Pyronychia, commonly known as bacterial nail infection, is inflammation of the region of the finger or toe from which the nail plate originates, which is called the proximal nail fold, PNF. This inflammation may occur in the short term, acute, or may be a long-term problem or one that keeps coming back, chronic. Patch test. Skin allergies. Patch testing is a common outpatient procedure used by dermatologists and allergists to assess if a rash is caused by a suspected substance, known as an allergen, when it comes in contact with the patient's skin. Pediculosis capitis. Head lice. Head lice, pediculosis capitis, are highly contagious, and the most prominent symptom of a head lice infestation includes intense scalp itching. The human head louse is a tiny insect that feeds on human blood. The female louse lays eggs, nits, on the hair shaft close to the scalp, and they become glued to the hair shaft. Pediculosis pubis. Pubic lice. Pubic lice, pediculosis pubis, also known as crab lice or crabs, is a louse, a type of wingless, blood-sucking insect, that can live and multiply, infest, on skin that grows pubic hair. Pubic lice most commonly affect the pubic hair, but other hair-bearing areas, such as the armpits and eyelashes, eyebrows, or scalp, may also be affected. Pemphigus vulgaris. Pemphigus vulgaris, PV, is an autoimmune disease of the skin and mucous membrane. As many as 80% of cases first exhibit symptoms in the mouth, mucous membrane. Pemphigus vulgaris is characterized by multiple lesions or blisters that do not heal or recur and spread to larger portions of the body. Perioral dermatitis. Perioral dermatitis is an acne-like condition of unknown cause. Some possible causes are the use of topical corticosteroid creams, cosmetic products, oral contraceptives, fluoride and anti-tartar ingredients in dental products, and it tends to occur in those prone to eczema. Perioral dermatitis, pediatric. Perioral dermatitis is an acne-like problem commonly seen around the mouth in children. Children are otherwise well, but they develop small pink bumps around the mouth and sometimes around the nose and eyes. Phototherapy. Phototherapy uses ultraviolet, UV, light under medical supervision to treat certain skin diseases. Depending on the skin disorder being treated, phototherapy is delivered for several seconds to minutes per session, usually 2-3 times per week. Pilar cyst. Pilar, tricholemal, cysts, sometimes referred to as wens, are common fluid-filled growths, cysts, that form from hair follicles that are most often found on the scalp. The cysts are smooth and mobile, filled with keratin, a protein component found in hair, nails, and skin, and they may or may not be tender. Pink eye, conjunctivitis. Pink eye, conjunctivitis, is an inflammation of the tissue on the surface of the eye and/or the inside lining of the eyelids. Pitted keratolysis. Pitted keratolysis is a skin condition affecting the soles of the feet and, less commonly, the palms of the hands. It is caused by a bacterial infection of the skin and may give off an unpleasant odor. Pityriasis alba. Pityriasis alba is a common non-cancerous, benign, skin condition affecting children. It appears as light-colored patches, especially on the cheeks. Pityriasis rosea. Pityriasis rosea, PR, is a common non-cancerous, benign, rash that mostly affects the back, chest, and abdomen. It starts fairly quickly, lasts about 6-8 weeks, and is usually not itchy. Plague, bubonic. Bubonic plague is an illness caused by the bacterium Yersinia pestis. This bacterium is carried by a certain type of flea, commonly known as a rat flea, which infects humans and animals. Humans can get bubonic plague from the bite of an infected flea, from the bite of an animal infected with Y. pestis, or from handling the carcass of an infected animal. Plantar wart. Warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. The virus causes thickening of the top skin layer. A plantar wart occurs on the sole of the foot. It can look and feel like a callus. Plantar warts can be small, or they can grow to cover most of the sole of the foot. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Poikiloderma of civet. Poikiloderma of civet is a chronic, non-cancerous, benign, skin condition in fair-skinned adults, which is probably caused by long-term sun exposure. Poikiloderma of civet shows a specific pattern of color change in the skin due to sun damage to the neck and sometimes the center of the chest. Poison ivy, oak, and sumac. Poison ivy, poison oak, or poison sumac dermatids are a reaction to the Rus antigen, which is found in poison ivy, poison oak, and poison sumac plants. Polydactyly, supernumerary digit. Supernumerary digits refer to the occurrence of extra, more than 10, fingers, toes, or parts of these digits. The medical term for this condition is polydactyly. The diagnosis can be divided into 3 classifications: preaxial polydactyly, postaxial polydactyly, and central polydactyly. Port wine stain. A port wine stain is a type of birthmark that is caused by a malformation of tiny blood vessels called capillaries. The name port wine stain comes from the color of the birthmark, which ranges from light pink to a dark red color. Post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation is darkening of the skin in an area of prior injury or skin disorder from increased pigment, melanin, left from the healing process. Sometimes the darkening may also be due to an iron pigment left behind when old red blood cells die. Post-inflammatory hypopigmentation. Post-inflammatory hypopigmentation is a loss of skin color, pigmentation, after your skin heals from an injury. The pigment-producing cells, melanocytes, are damaged or destroyed in the healing process. Presbyopia. Presbyopia is an age-related change in vision whereby one loses the ability to see near without corrective lenses or corrective surgery. The cause of presbyopia is a change in the ability of the human lens to change its shape, a process called accommodation, to allow one to focus on objects that are at close range. Pressure ulcer, decubitus ulcer, bed sores. Pressure ulcers, also known as pressure sores or decubitus ulcers, result from prolonged pressure that cuts off the blood supply to the skin, causing the skin and other tissue to die. The damage may occur in as little time as 12 hours of pressure, but it might not be noticed until days later when the skin begins to break down. Primary syphilis. Primary syphilis is a disease caused by a corkscrew-shaped bacterium, a spirochete, called Treponema pallidum. It causes disease when it penetrates broken skin of the genitals or the mucous membranes of the mouth or anus. Pruritic urticarial papules. Plagues of pregnancy, PUP. Pruritic urticarial papules and plagues of pregnancy, PUP, is the most common skin condition of pregnancy. Typically, women affected by PUP develop red, itchy bumps on the belly near stretch marks, striae, during their 3rd trimester. Pseudofolliculitis barbae, razor bumps, Pseudofolliculitis barbae, also known as shaving bumps, affects men with tightly curved, or curly, hairs. The problem is a reaction to the tip of the hair growing back under the skin or into the hair follicle after a close shave. Razor bumps is not an infection but rather a foreign body reaction, much like the body would react to a splinter of wood in the skin. Psoriasis. Psoriasis is a non-contagious, lifelong skin condition that affects about 2–3% of the population of the United States. People with psoriasis have thickened, red, and often scaly patches on their skin. Pubic lice, pediculosis pubis, pubic lice, pediculosis pubis, also known as crab lice or crabs, is a louse, a type of wingless, blood-sucking insect, that can live and multiply, infest, on skin that grows pubic hair. Pubic lice most commonly affect the pubic hair, but other hair-bearing areas, such as the armpits and eyelashes, eyebrows, or scalp, may also be affected. Pyogenic granuloma. Pyogenic granuloma is a common, benign growth that often appears as a rapidly growing, bleeding bump on the skin or inside the mouth. It is composed of blood vessels and may occur at the site of minor injury. Raynaud's phenomenon. Raynaud's disease is a disorder in which the blood vessels to the fingers and toes, digits, become abnormally closed off, constricted. The fingers and toes of individuals with Raynaud's disease change color from white to blue to red, often causing them to feel numb. Razor bumps. Pseudofolliculitis barbae. Razor bumps, pseudofolliculitis barbae, also known as shaving bumps, affects men with tightly curved, or curly, hairs. The problem is a reaction to the tip of the hair growing back under the skin or into the hair follicle after a close shave. Razor bumps is not an infection but rather a foreign body reaction, much like the body would react to a splinter of wood in the skin. Recurrent corneal erosion. A recurrent corneal erosion is the recurrent breakdown of the outermost layer, epithelium, of the cornea. In recurrent corneal erosions, the outermost layer of the cornea fails to glue in tightly to its underlying membrane, basement membrane, making it possible for the epithelium to break off too easily with little effort. Ringworm, Tinea corporis. Tinea infections are commonly called ringworm because some may form a ring-like pattern on affected areas of the body. Tinea corporis, also known as ringworm of the body, Tinea circinata, or simply ringworm, is a surface, superficial, fungal infection of the skin. Ringworm, beard, Tinea barbae. Tinea infections are commonly called ringworm because some may form a ring-like pattern on affected areas of the body. Beard ringworm, Tinea barbae, also known as tinea psychosis or barber's itch, is a fungal infection of the skin, hair, and hair follicles of the beard and mustache area. Ringworm, facial, Tinea facii. Tinea infections are commonly called ringworm because some infections form a ring-like pattern on affected areas of the body. Facial ringworm, Tinea facial, also known as Tinea facii or ringworm of the face, is a common, non-cancerous, benign, fungal infection of the surface, superficial, skin of the face. Ringworm, scalp, Tinea capitis. Scalp ringworm, Tinea capitis, is a common mild infection of the scalp and hair that appears as scaly spots and patches of broken hair on the head. Caused by a fungus, it is most commonly seen in children. Rosacea. Rosacea, sometimes called adult acne, is a chronic inflammation of the face of unknown cause and without a permanent cure. Roseola, sixth disease. Roseola, also known as sixth disease, exanthem subitum and Roseola infantum, is a mild illness that mainly affects children that will go away on its own. Roseola is caused by viruses of the herpes type. Infected children have a few days of high fever followed by a rash as the fever goes down. Rubella, German measles. German measles, rubella, is caused by the rubella virus and spreads among humans through contact with fluids in the respiratory tract. The development, incubation, period of German measles is 14–21 days before starting to feel ill, and a rash accompanied by fever appears 1–7 days later. Rubeola, measles, rubeola, is a highly contagious infection of the respiratory system, which is caused by a virus. It does not occur often in the United States, since immunizations have been required since the 1960s. Sacral herpes. Herpes simplex infection of the lower back and buttocks, also called sacral herpes simplex or genital herpes, is a common, recurrent skin condition associated with infection by the herpes simplex virus, HSV. HSV infection usually appears as small blisters or sores around the mouth, nose, genitals, buttocks, and lower back, though infections can develop almost anywhere on the skin. Salmon patch. Salmon patch is the name given to a very common group of birthmarks seen in babies. The birthmarks are caused by expansions, dilations, in tiny blood vessels called capillaries. When a salmon patch occurs on the face, it is often called an angel kiss, and when it occurs on the back of the neck, it is known as a stork bite. Salmonella, salmonellosis. Salmonella is the name for a family of bacteria that cause diarrheal illness in humans. Salmonella is most commonly thought of as the bacteria that lives on raw poultry, and while this is true, it is also found on raw beef, milk, eggs, and even fruits and vegetables. It can be spread directly from the contaminated food or from fecal contact with an infected person. Salmonellosis. Salmonella is the name for a family of bacteria that cause diarrheal illness in humans. Salmonella is most commonly thought of as the bacteria that lives on raw poultry, and while this is true, it is also found on raw beef, milk, eggs, and even fruits and vegetables. It can be spread directly from the contaminated food or from fecal contact with an infected person. Scabies. Scabies is an infestation of the skin caused by a tiny mite called Sarcoptes scabii var. Hominis. Scabies is very contagious and spreads rapidly in crowded areas such as hospitals, nursing homes, child care facilities, prisons, and other locations where people spend extended periods of time in close contact with one another. Scabies, pediatric. Scabies is an itchy skin condition caused by a tiny parasite, mite, called Sarcoptes scabii that can live and multiply, infest, on skin. They are passed between people by prolonged skin-to-skin contact. Scaly skin, ichthyosis vulgaris. Ichthyosis vulgaris, also known as common ichthyosis or fish scale disease, is a skin condition resulting in scaly skin, especially on the arms and legs. Its name is derived from the Greek word meaning fish. Scarlet fever. Scarlet fever is an infection with a type of bacteria called Streptococcus, which not only causes a throat infection, strep throat, but also produces a poison, toxin, causing the distinctive rash of scarlet fever. Some people are more sensitive to the toxin than others, so not everyone in a family who is infected will have the rash, even if they have the throat infection. Scarlet fever, scarlatina. Scarlet fever is an infection with a type of bacteria called Streptococcus, which not only causes a throat infection, strep throat, but also produces a poison, toxin, causing the distinctive rash of scarlet fever. Some people are more sensitive to the toxin than others, so not everyone in a family who is infected will have the rash, even if they have the throat infection. Sebaceous hyperplasia. Sebaceous hyperplasia is a common harmless enlargement of the skin oil glands. Seborrheic dermatitis. Seborrheic dermatitis, also known as seborrhea, is a common non-contagious condition of skin areas rich in oil glands, the face, scalp, and upper trunk. Seborrheic dermatitis is marked by flaking, overproduction of skin cells, and sometimes redness and itching, inflammation, of the skin, and it varies in severity from mild dandruff of the scalp to scaly, red patches on the skin. Seborrheic dermatitis, pediatric. Seborrheic dermatitis in infants is a common non-contagious condition of skin areas rich in oil glands, e.g., the face, scalp, and upper trunk. Seborrheic dermatitis is marked by overproduction of skin cells, leading to flaking, and sometimes inflammation, leading to redness and itching. It varies in severity from mild dandruff of the scalp to scaly, red patches on the skin. Seborrheic keratosis. Seborrheic keratoses are common benign growths of unknown cause seen in adults due to a thickening of an area of the top skin layer. Shingles, zoster. Shingles, also known as herpes zoster, is a painful rash caused by the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus remains sleeping, dormant, in certain nerves in the body. Shock, first aid and self-care information for shock. Shock is a medical emergency where the flow of blood through the body is reduced, limiting the amount of oxygen the blood carries to the body's cells. While shock is a life-threatening condition that requires immediate treatment by a medical professional, giving first aid early, while waiting for emergency care to arrive, can help shock from becoming worse. Sinus headache. Sinus headache involves head pain in the setting of irritation of the sinuses, air-filled chambers present in several bones of the face. This irritation can be secondary to infection of the sinuses by viruses, bacteria, fungi, or other organisms, or may be secondary to allergies. Skin renewal, laser, photorejuvenation, simply put, is the use of light, in laser or non-laser form, to make the skin look younger. Aged skin has wrinkles, brown spots, uneven texture, and sags due to gravity. The latest lasers tend to work very well for most age-related problems except for sagging skin and lines due to muscle expression. Skin tag, acrocordon. A skin tag, acrocordon, is a common, possibly inherited condition that manifests as small, flesh-colored growths on a thin stalk. Skin tags are benign lesions that can sometimes become irritated or traumatized. Smallpox, variola. Smallpox is a disease caused by the variola virus, a virus that is carried and transmitted only in humans. Through a careful program of vaccination, the variola virus is now completely eradicated. The only variola virus known to exist is stored in 2 labs, one in Atlanta and one in Moscow. Snake bite, first aid and self-care information for a snake bite. There are 2 kinds of snake bites, poisonous, venomous, and non-poisonous, non-venomous. Most snakes are non-poisonous, and bites from such snakes can be treated as puncture wounds. First aid for puncture wounds can be found in the wound text. Poisonous snake bites are much less common but much more dangerous, and they can even be deadly. Solar lentigo, a solar lentigo, plural, solar lentigines, also known as a sun-induced freckle or senile lentigo, is a dark, hyperpigmented, lesion caused by natural or artificial ultraviolet, UV, light. Solar lentigines may be single or multiple. This type of lentigo is different from a simple lentigo, lentigo simplex, because it is caused by exposure to UV light. Spider angioma. A spider angioma is a grouping of small blood vessels at the skin surface. The pattern sometimes resembles the threads of a spider's web. Splinter, first aid and self-care information for a splinter. A splinter, or sliver, is a particle of a foreign object, such as a small piece of wood that has embedded itself in one's skin. Splinters can sometimes come out on their own or be pulled or milked, by gently squeezing on each side of the splinter, out easily, but others can be deeply embedded and difficult to remove. All splinters should be removed as promptly as possible. If a splinter becomes wet, it makes the area prone to infection. Squamous cell carcinoma, SCC. Squamous cell carcinoma, SCC, is the second most common form of skin cancer. Squamous cell carcinoma usually occurs on sun-damaged skin, especially in light-skinned individuals with a long history of chronic sun exposure. Stasis dermatitis. Dermatitis is a term used to describe irritation of the skin with scaling, rough or dry skin, redness, itching, and sometimes oozing, crusts, and erosions. Stasis is a term used to describe leg swelling seen in conditions of poor circulation and fluid buildup. Stasis ulcer. A stasis ulcer is a breakdown of the skin, ulcer, caused by fluid buildup in the skin from poor vein function, venous insufficiency. Fluid leaks from the veins into skin tissue when the blood backs up rather than returning to the heart through the veins. Stitches, surgical sutures, also known as stitches, are synthetic or animal gut-derived threads used to close a wound after a surgical procedure or injury. A variety of sutures exist that vary in size, strength, and durability. Stitches placed deep inside the wound always require the use of dissolvable, absorbable, sutures, whereas stitches visible on the skin, placed superficially, may use dissolvable or non-dissolving, non-absorbable, sutures. Strawberry hemangioma, infantile hemangioma. Hemangiomas are harmless tumors that are the result of rapidly dividing cells of the blood vessel walls, known as endothelial cells. They are present at birth or shortly after and grow rapidly during the first year of life. They usually resolve on their own over the next few years. Stretch marks, striae, stretch marks, striae, are stripe-like skin marks that develop as a result of rapid weight gain or loss, when the skin is stretched, and as a result of some diseases. Stretch marks of pregnancy, striae of pregnancy, striae gravidarum, stretch marks in pregnancy, occur in about 90% of all pregnant women. They are primarily due to the rapid rate at which the skin is being stretched, combined with the influence of hormones. Striae, stretch marks, striae, are stripe-like skin marks that develop as a result of rapid weight gain or loss, when the skin is stretched, and as a result of some diseases. Striae of pregnancy, striae gravidarum, stretch marks in pregnancy, occur in about 90% of all pregnant women. They are primarily due to the rapid rate at which the skin is being stretched, combined with the influence of hormones. Stye, hordeolum and chalazion. A stye, hordeolum, is a local, acutely inflamed growth, swelling, lesion, of the eyelid. They can occur at the lid margin or farther up the lid on either the inner, tarsal, side or the outer, skin, side of the lid. A chalazion is the chronic form of a stye, and its cellular makeup is different than that of a stye. Sunburn. Sunburn is caused by the skin's reaction to ultraviolet light exposure. It appears as reddening and tenderness of the skin and usually occurs between 12 and 24 hours after the exposure. Sunburn. First aid and self-care information for sunburn. Sunburn is caused by the skin's reaction to ultraviolet light exposure. It appears as reddening and tenderness of the skin and usually occurs between 12 and 24 hours after the exposure. Supernumerary digit. Supernumerary digits refer to the occurrence of extra, more than 10, fingers, toes, or parts of these digits. The medical term for this condition is polydactyly. The diagnosis can be divided into three classifications: preaxial polydactyly, postaxial polydactyly, and central polydactyly. Supernumerary nipple. Supernumerary nipple is a medical term to describe the presence of one or more extra nipples that might be present on a baby's body. These are equally common in both males and females, and they are always benign, not life-threatening or cancerous. Suture. Surgical. Sutures, also known as stitches, are synthetic or animal gut-derived threads used to close a wound after a surgical procedure or injury. A variety of sutures exist that vary in size, strength, and durability. Stitches placed deep inside the wound always require the use of dissolvable, absorbable, sutures, whereas stitches visible on the skin, placed superficially, may use dissolvable or non-dissolving, non-absorbable, sutures. Sweaty sock syndrome, juvenile plantar dermatosis. Sweaty sock syndrome, juvenile plantar dermatosis, is a condition where the skin becomes scaly and red on the soles of the feet of children and young teenagers. The cause of sweaty sock syndrome is unknown, though alternating moist and dry conditions may lead to the condition. Syphilis, primary. Primary syphilis is a disease caused by a corkscrew-shaped bacterium, a spirochete, called Treponema pallidum. It causes disease when it penetrates broken skin of the genitals or the mucous membranes of the mouth or anus. Syringoma. Syringoma is a non-cancerous, benign, bump usually found on the upper cheeks and lower eyelids of young adults. Syringomas are completely harmless and are caused by the overgrowth of cells from sweat glands, eccrine glands. Systemic lupus erythematosus. Systemic lupus erythematosus, SLE, also called lupus, is a chronic inflammatory disease that can affect almost any part of the body, especially the skin, joints, kidneys, heart, lungs, bones, blood, or brain. Systemic lupus erythematosus is considered an autoimmune disorder, meaning that a person's own immune system attacks his or her own healthy cells and tissues, causing inflammation and damage. Tattoo removal, laser. Many people no longer care to have a permanent tattoo for a variety of personal or fashion-related reasons. While there are many methods of removing tattoos, laser tattoo removal with the latest technology offers the ability to partially or fully eliminate a tattoo with little risk of scarring. Telangiectasia. Telangiectasias are widely open, dilated, blood vessels in the outer layer of the skin. When seen on the legs, they are often called spider veins. Tension headache. Tension headache involves intermittent episodes of head discomfort that are mild to moderate in intensity, include non-throbbing tightness or pressure, generally on both sides of the head, and are not aggravated by routine physical activity. Nausea, vomiting, and light/sound sensitivity are rarely present. Tension headache, chronic. Chronic tension headache is a syndrome of headaches that are mild to moderate in intensity, involve tightness or pressure on both sides of the head, and are not aggravated by routine physical activity. Nausea, vomiting, and light/sound sensitivity are usually not present and, if so, are mild and infrequent. Thrush, oral candidiasis. Thrush, oral candidiasis, also known as oral moniliasis, is a yeast infection of the mouth or throat, the oral cavity. The yeast that most commonly causes oral candidiasis is Candida albicans. Tick bites, first aid and self-care information for tick bites. Ticks are 8-legged creatures, arachnids, that live in wooded and grassy areas. Ticks attach themselves to a human host as the person brushes past leaves, grass, etc. that the tick is on. Ticks do not jump or fall on a person. Once on a person, ticks move to a warm and moist location, e.g., armpit, groin, back of the knee, hairline, where they burrow into the host's skin and feed off their blood. Tinea barbae, ringworm of beard. Tinea infections are commonly called ringworm because some may form a ring-like pattern on affected areas of the body. Beard ringworm, Tinea barbae, also known as tinea psychosis or barber's itch, is a fungal infection of the skin, hair, and hair follicles of the beard and mustache area. Tinea capitis, ringworm of scalp, scalp ringworm, Tinea capitis, is a common mild infection of the scalp and hair that appears as scaly spots and patches of broken hair on the head. Caused by a fungus, it is most commonly seen in children. Tinea corporis, ringworm of body. Tinea infections are commonly called ringworm because some may form a ring-like pattern on affected areas of the body. Tinea corporis, also known as ringworm of the body, Tinea circinata, or simply ringworm, is a surface, superficial, fungal infection of the skin. Tinea cruris, jock itch. Tinea cruris, is a surface, superficial, fungal infection of the skin on either side of the body where the thigh joins the abdomen, known as the groin. It is often spread to the groin from tinea infection on the feet, tinea pedis or athlete's feet. Tinea facii, ringworm of face. Tinea infections are commonly called ringworm because some infections form a ring-like pattern on affected areas of the body. Facial ringworm, Tinea facial, also known as Tinea facii or ringworm of the face, is a common, non-cancerous, benign, fungal infection of the surface, superficial, skin of the face. Tinea pedis, athlete's foot, ringworm of foot or feet. Tinea pedis, also known as ringworm of the foot or athlete's foot, is a surface, superficial, fungal infection of the skin of the foot. The most common fungal disease in humans, athlete's foot, may be passed to humans by direct contact with infected people, infected animals, contaminated objects, such as towels or locker room floors, or the soil. Tinea versicolor, Tinea versicolor, also known as pityriasis versicolor, is a common, non-cancerous, benign, skin condition caused by surface, superficial, infection with a type of yeast that normally lives on the skin. In the right conditions, such as warm, oily, and moist skin, the yeast, Malassezia, can overgrow and cause a rash, consisting of tan, pink, brown, or white patches. Trench fever. Trench fever is a bacterial infection caused by the bacterium Bartonella quintana, which is carried and transmitted to humans by the common body louse, a small, wingless insect that lives in the clothes of infested people. Typhoid fever. Typhoid fever is the name given to the illness caused by the bacterium Salmonella typhi, a member of the Salmonella family. Typhoid fever is spread through food and water contaminated by animal and human feces. Ulcer, aphthis, canker sore, canker sores, aphthis ulcers, or aphthy, are the most common cause of periodic, recurring, ulcers inside the mouth and genital linings, mucous membrane surfaces. Their cause is unknown, but stress, lack of sleep, trauma, and perhaps some vitamin deficiencies, toothpastes, and foods can make the condition worse. Ulcer, stasis, venous ulcer. A stasis ulcer is a breakdown of the skin, ulcer, caused by fluid buildup in the skin from poor vein function, venous insufficiency. Fluid leaks from the veins into skin tissue when the blood backs up rather than returning to the heart through the veins. Unconsciousness, first aid and self-care information for unconsciousness. Unconsciousness is an abnormal state in which a person is not alert and not fully responsive to his/her surroundings. Levels of unconsciousness range from drowsiness to collapse and may range in severity from fainting to coma. Urticaria, hives, urticaria, also known as welts, is a common skin condition with an itchy rash of pink to red bumps that appear and disappear anywhere on the body. An individual lesion of hives typically lasts a few hours before fading away, and new hives can appear as older areas disappear. Varicella, chickenpox. Chickenpox, varicella, is an infectious disease caused by the varicella zoster virus that goes away on its own. Infection spreads among humans through fluids from the airways, such as from coughing and sneezing, with non-infected household members at high risk of becoming infected as well. Varicose veins, varicosities, are twisted, enlarged veins at the skin surface. The word comes from the Latin word varix, which means twisted. Varicosities, varicose veins, varicosities, are twisted, enlarged veins at the skin surface. The word comes from the Latin word varix, which means twisted. Vascular lesion treatment, laser. Lasers produce high-intensity light that can be used to selectively heat blood vessels. A variety of machines can be used, although the effectiveness and side effects for an individual can vary. The advantage of lasers is the ability to target the blood vessel while leaving the surrounding tissue undamaged. Viral exanthem, also known as nonspecific viral rash, is a rash caused by a viral infection. Many viruses can cause a similar appearing rash, so it is difficult to tell which one is the culprit. Your age, duration of illness, and other symptoms may suggest which virus is the cause. Respiratory and stomach, gastrointestinal, viruses are common causes of such a rash. Vitiligo. Vitiligo is a disease where the immune system turns against itself, autoimmune disease, where immune cells of the body attack the color-producing, pigment-producing, cells to cause white patches on the skin, which may contain hairs that are white in color. Wart, common, verruca vulgaris, HPV, warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. Common warts are usually found on areas of the body prone to trauma, such as the elbows, knees, and hands. The virus causes thickening of the top skin layer. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Wart, flat, HPV, warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. The virus causes thickening of the top skin layer. Flat warts tend to stay small in size but can be numerous in quantity. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Wart, plantar, HPV, warts are growths of the skin and mucous membranes, the mouth or genitals, that are caused by over 100 types of the human papillomavirus, HPV. The virus causes thickening of the top skin layer. A plantar wart occurs on the sole of the foot. It can look and feel like a callus. Plantar warts can be small, or they can grow to cover most of the sole of the foot. They are usually painless and go away on their own, sometimes taking a few months to resolve, but can take up to 2 years. Woods lamp examination. A Woods lamp is a device that emits ultraviolet, UV, light in the 365 nanometer range and is commonly used by dermatologists to assist in the diagnosis of various pigment and infectious disorders. The examination is performed in a dark room, allowing the Woods light to shine directly on the affected area for a few seconds and looking for any changes in color or fluorescence. Wounds, first aid and self-care information for wounds. A wound is any type of injury that breaks the skin, and severity can range from a small cut to a deep puncture wound. To prevent infection and promote healing, all wounds need care. A scrape, abrasion, is when the surface of the skin is injured on a hard or rough surface, causing the skin ooze, and, often, bleed. A cut has a clean edge, while a tear has a jagged edge. X. Xanthelasma palpebrarum. Xanthelasma palpebrarum, is a skin condition that develops flat yellow growths on the eyelids. Xanthelasma is often seen in people with high cholesterol or other fat, lipid, levels in the blood, and the lesions contain deposits that are high in fat, lipid-rich. Xerosis, dry skin. Xerosis is a condition of rough, dry skin with fine scaling of skin and, occasionally, with small cracks in the skin. Dry skin is also known as winter itch or astiotosis. Y. Yeast infection. Candidiasis. Candidiasis, commonly known as a yeast infection, is an infection with the common yeast, or fungus, organism, Candida albicans, which is commonly found in the environment. Sometimes this yeast lives in the mouth, digestive, gastrointestinal tract, and the vagina, along with many kinds of harmless bacteria, without causing any issues. Yellow fever. Yellow fever is a viral illness caused by the bite of a mosquito carrying the yellow fever virus. Yellow fever received its name from the yellow discoloration, known as jaundice, to some patients' skin. Zoster, shingles. Herpes zoster, shingles, also known as herpes zoster, is a painful rash caused by the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus remains sleeping, dormant, in certain nerves in the body. Chapter 3. A glossary of skin terms. A glossary of skin terms. Abscess, deep collection of pus caused by a skin infection. Angioedema, temporary, rapid swelling of the skin. Annular, ring-shaped lesion. Atrophy, loss of tissue density. Bulla, AE, large, fluid-filled blister, S, greater than 0.5 centimeters. Crust, dried skin fluid. Cyst, distinctive, closed sac-like structure in the skin, usually fluid with a semi-solid substance. Dermographism, writing on the skin, red, raised and inflamed skin due to firm stroking. Desquamation, peeling of superficial scales. Ecchymosis, bruise, a collection of blood in the skin. Emollient, moisturizer to soften and soothe the skin. Eroded, superficial loss of the epidermis. Excoriations, scratch marks causing partial/complete loss of the epidermis. Fissures, slits through the whole thickness of the skin. Fitzpatrick skin type, numerical classification of skin color from type I, white, to type 6, black. Fomites, inanimate object able to carry and hence transfer infectious particles. Furuncles, deep boil, skin infection, affecting the entire hair follicle. Heart, highly active antiretroviral therapy. Hyperkeratosis, thickening of the epidermis, stratum corneum. Hypertrichosis, hair growth perceived to be excessive on the skin. Induration, hardening of the skin, e.g. Due to inflammation, accumulation of fluid or tumor cells. Koebner's phenomenon, skin lesions appearing in the lines of trauma. Lentigines, small area of increased pigmentation of the skin. Lichenification, thickening of the skin with prominent skin markings. Maceration, continually wet skin turns soft and white. Macule, change in the pigmentation of the skin, color change, without any elevation. Non-palpable. Nikolsky's sign, sloughing off of the epidermis from the dermis caused by lateral pressure. Nodule, circumscribed raised lesion greater than 1 cm in diameter. Edema, fluid, in the skin. Onycholysis, lifting/separation of the nail plate off the nail bed. Papule, circumscribed raised lesion of 0.5 to 1.0 cm in diameter. Pedunculated, lesion/mass supported on a stalk. Plaque, circumscribed elevated plateau area, usually greater than 1 cm in diameter. Pruritus, itching, a sensation you feel. Purpura, purple non-blanching color in the skin, usually due to damaged vasculature. Stomatitis, inflammation of the mucous lining of the oral cavity. Telangiectasia, small, dilated blood vessels near the skin/mucosal surface. Ulceration, results from loss of the entire epidermis and dermis. Vesicles, fluid-filled lesions, blister usually clear fluid, may be hemorrhagic. Chapter 4. Some skin conditions. 1. Dry skin info. Dry skin is called xerosis. Dry skin has a low level of sebum. Dry skin types have to be careful to protect their skin. A yogurt-honey combination helps dry skin. A yolk, honey, and milk powder makes a healthy pate for dry skin types. Tap water contains chlorine and other chemicals. Avoid using it to cleanse dry skin. Use mineral water or bottled water. Use non-detergent, neutral pH products to clean your skin. Don't use regular soap. Use cream or moisturizer. Avoid using a rough textured washcloth because it can scratch dry skin. When drying skin, do not rub. Pat dry it. Drink at least 8 glasses of water a day to keep your skin well hydrated. Add olive oil or lavender scented oil to your bath. Avoid caffeine and alcohol, which cause dehydration. Do not use very hot water when bathing or showering. Apply aloe vera gel topically on dry skin. Dermatitis info. Dermatitis refers to an inflammation of the skin, both external and internal, characterized by redness, swelling, heat and pain or itching. Any part of the body may be affected by this disease. The genital areas and the exposed areas such as the eyelids, forearms, face, and neck are more prone to it. The cells of the epidermis, the surface layer of the skin, could lose their elasticity as water content gets low. Substances which produce inflammation of the epidermis or dermatitis are degreasing agents like soaps and other chemicals, if used too frequently over a short time. The first symptom is erythema or redness. This is usually followed by swelling of the skin due to edema, excessive fluid retention. Vesicle may appear thereafter. In case of their rupture, their bases exude serum. This condition is known as weeping dermatitis. Later, the serum dries up to form crusts. Chemical substances may reach the skin from outside or from inside through the bloodstream. About 100 different plants are known to be capable of causing dermatitis. Certain drugs applied externally such as atropine, belladonna, carbolic acid, iodine, mercury, penicillin, sulfonamides, sulfurs, tars and turpentine sometimes cause dermatitis. Other substances causing this disease include hair dyes, bleaches, skin tonics, nail polish, perfume, wool, silk, nylon, floor wax and various detergents. Other causes of this disease are a poor diet, deficiency of vitamin A and pantothenic acid and stress. If the dermatitis originates from internal causes as opposed to a chemical contacting the skin, eat a healthy diet, detox your body, get exercise, and relax. In case of trouble due to external causes, the most effective treatment consists of applying a mixture of baking soda, bicarbonate of soda, and olive oil. The alkaline sodium neutralizes the poisonous acids formed in the sores, and oil keeps the flesh in a softened condition. Eczema/skin inflammation/atopic dermatitis. Atopic dermatitis, commonly referred to as eczema, is a chronic skin disorder categorized by scaly and itching rashes. People with eczema often have a family history of allergic conditions like asthma, hay fever, or eczema. Dermatitis is a blanket term for any kind of skin inflammation. It is called eczema, atopic eczema, and dermatitis eczema. Dermatitis/eczema is a skin disorder that people get who have a family history of eczema, hay fever, or asthma. The three are all related. People who have asthma often have eczema and vice versa. Eczema is characterized by itchiness and scaliness partially caused by allergic reactions to food and toxins in the environment. It is also caused by an immune system deficiency. There are a variety of conditions that can cause and/or can aggravate asthma, hay fever, and eczema. Anxiety, food allergy, infection, pollen, stress, sweating, worry. The basis of eczema is the inability of the skin to retain adequate amounts of water. The skin is very dry, which causes it to itch, causing the person to scratch, which further aggravates the condition. The scratching produces what is called weeping, infected skin, which cause the skin to crust. The term eczema is derived from a Greek word meaning to boil. The skin inflammation results in the formation of vesicles or pulstules. Eczema results from a toxic condition of the system. Eczema in its acute form is indicated by redness and swelling of the skin, the formation of minute vesicles, and heat. If the vesicles rupture, a raw, moist surface is formed which forms skin crusts when it accumulates and dries. The skin itches. Scratching spreads the infection. Some women get eczema on their hands due to an allergy to soap or detergents used to wash clothes or dishes. Some persons develop it around the fingers when they wear rings because of allergy to metals. The most common triggers for sensitive persons are eggs, peanuts, chocolate, wheat, cow's milk, chicken, and potato. People who have eczema also often have other allergic conditions such as allergic rhinitis or asthma. Most people have dry skin at some point, but people with eczema have occasional eruptions of red, scaly patches of skin. Anything that dries or irritates the skin may trigger an eczema episode. Try to bathe no more than once a day. Use mild soap to avoid drying the skin out. Apply a moisturizing lotion to your skin. See a dermatologist who will examine the skin eruptions, then prescribe a cream or ointment containing a corticosteroid to relieve inflammation. If the skin is infected because of scratching, the doctor will prescribe an antibiotic. There is also treatment with ultraviolet light and oral corticosteroid medication. Eczema could be caused by the material you wear. In infants, eczema may be found in the area where they are wearing plastic pants. In serious cases, eczema gets infected with bacteria, then it's time to go to the doctor for professional treatment. The range of eczema varies greatly. For some, it's a minor ailment. For others, it's a serious condition they have to deal with most of their lives. The treatment for eczema is basically the same as for any allergy, assuming it is caused by an allergy, which some cases aren't, but there is some precursor for it like stress, food, pollen, etc. Take care of your skin. Watch your health. Drink lots of water to help keep the skin moisturized. Contrary to the myth, bathing is not a good treatment. It actually makes the skin drier. During the bath, you might feel more comfortable, but afterwards, when you dry off, the skin will feel drier and you will feel more itchy. When you shower or bath, instead of soap, use non-lipid cleansers with cetyl alcohol such as Cetaphil. If you have eczema on the hands, use rubber gloves to protect them when washing things like the dishes or the car. Don't swim in fresh water. Ocean swimming doesn't seem to aggravate the skin as much. Sweating aggravates eczema. So does certain types of clothing like those made out of wool and silk. Cotton is fine. Don't put oily creams on the infected area. They keep the skin from breathing and keep sweat in. Try not to scratch. See what over-the-counter medications and antihistamines they have at the drugstore to help reduce itching. Avoid cow's milk, especially for children. It could be an aggravating factor. Try the elimination diet technique to see if it is. Go off milk for about 4 days, then on the 5th day, drink several cups to see if this causes your eczema to flare up. Eczema is term for a group of medical conditions that cause the skin to become inflamed or irritated. Eczema websites: eczema.org, webmd.com/allergies/guide/eczema, medicinenet.com/eczema/article.htm, dermatechrx.com/eczema, amoils.com/eczema.html, proveneczemacures.com, acnepreventionnow.com/eczema/eczema-treat.html, aad.org/public/publications/pamphlets/eczema-atopic-dermatitis.htm, eczemabathsalts.com, eczema.org, the National Eczema Society, nationaleczema.org, National Eczema Association, eczemaskintreatment.com, eczema-tips.com, eczema.org, eczema-dermatititis.get-medical-advice.info, National Eczema Association, 1220 SW Morrison, number 433, Portland, Oregon 97205, 800-818-7546, 503-228-4430, fax 503-224-3363, eczema-assn.org. Holistic eczema treatments. The real cause of eczema and every skin disorder is the failure of the human system to excrete the poisons from the various orifices of the body. Waste matter is excreted from the rectum through stools, from the bladder through urine, from the lungs through breath, from the pores of the skin through sweat. Sometimes the pores of the skin are overworked as waste matter is not properly eliminated from the other orifices. If the pores are not given the chance to perform their normal function, the sweat will be full of morbid matter, and this gives rise to skin diseases like eczema, acne, boils, and other eruptions. Other causes include faulty metabolism, constipation, nutritional deficiencies, and stress brought about by nagging spouses, jealousy, frustration, and a host of other emotions. Suppressive drug treatment don't cure this. They give temporary relief. If the exudation is suppressed, some other more serious disease may develop. The best way to deal with eczema is to detox the bloodstream and the body. Do a fat, drink fruit juice, then eat healthy foods. Avoid tea, coffee, alcoholic beverages, and all condiments and highly flavored dishes. Avoid sugar, white flour products, denatured cereals like polished rice, and pearled barley and tinned or bottled foods. Eat only pure and wholesome foods. Walk or jog. Sunbathing kills the harmful bacteria. A light mud pack should be applied over the sites of the eczema is also helpful. proveneczemacures.com. Allergic contact dermatitis info. An allergy is an over-response by your immune system to something harmless that it perceives as a threat. When your skin comes into contact with anything that's probably harmless but your immune system sees as a threat, it reacts with typical allergic reactions. You produce histamine, the skin reddens and may blister. Substances that can trigger allergic contact dermatitis are rubber, hair dyes, cosmetics, chemicals and metals. Plants such as poison ivy, poison oak, and poison sumac produce rashes that are considered allergic contact dermatitis. The oils in mango skins and cashew nut shells can cause allergic contact dermatitis. The rash produced by allergic contact dermatitis will usually clear up on its own once the allergen has been removed. Avoid contact with the allergen. A dermatologist can help you identify your allergens. Read about general allergies to learn more. Lighten your skin. All about skinlightening.blogspot.com. Chapter 5. Some skin conditions too. Boils/furuncles/carbuncles/folliculitis. Boils are bacterial infections of hair follicles and surrounding skin. The skin gets infected in a small area around a hair follicle or oil gland. It's a skin abscess that begins as a reddened, sore area, then it hardens and fills with pus. A boil is a fairly common skin problem. It is usually caused by Staphylococcus bacteria. This bacteria inhabits a certain part of the skin and it may be difficult to get rid of it. Boils could occur in lots of one or more. They can occur on any part of the body including the facial area. They range from the size of a pencil eraser to the size of a silver dollar and even larger. Boils may result from infection of a cut or scrape in the skin, poor hygiene, cosmetics that clog the pores, exposure to chemicals, and friction from tight clothing or shoes. Boils and carbuncles usually appear on the scalp, beard area of the face, arms, legs, underarms, and buttocks. Once they have ruptured, boils and carbuncles heal. In some cases, surgical drainage may be required. Boils often start as infections around hair follicles. This is where the term folliculitis originated, which refers to the infection preceding the boil. The infection begins in the tissues below the skin and forms into an abscess, which is a small area or pocket filled with pus. Over time, this little container of pus breaches the surface skin and usually, in short order, it ruptures, drains and heals. A carbuncle is a more serious kind of boil that penetrates into the deeper layers of the skin. The most common treatment is to let the pus out. Applying a warm, moist compress gently over the infected area will help expedite the development of the boil and soften the skin for its eventual rupture, drainage, and healing. Keep the area clean. With serious boils that might cause a fever, the doctor will usually prescribe an antibiotic. Otherwise, antibiotics are not very effective with simple boils that have a pus infections. If the boil has not yet drained on its own, either you or the doctor can puncture it with a needle or knife to allow the pus to drain off, allowing the area to heal. Some boils drain on their own. You can either break the skin and squeeze the pus out yourself or get medical attention. alayaveda.com/ale_boils.htm Answers.com/topic/boil aokd.org/skin/dermatologic_diseases/boils.html Bexatrol.com, treatment for boils. Boilsinfo.com. Burn info. Burns are injuries most commonly caused by heat in the form of fire and water. They can also result from chemicals, electricity, or radiation. Heat burns are ranked according to the depth of skin injury. First-degree burns are superficial and may be painful, but because they don't penetrate beneath the skin, they are rarely serious even if they cover a large area of skin. Burns are characterized by degree. First degree, superficial, will have erythema, be dry and painful. A sunburn is a good example of a first-degree burn. Usually you don't need to see a doctor. It will heal on its own in time. Second-degree burns affect the upper and second layers of the skin but may heal without scarring unless widespread. Second-degree burns go deeper and cause blisters of the skin. An example may be a severe sunburn or a severe scalding. They are serious if they cover a large area of skin. Second degree, partial skin thickness, burns will be moist, painful, and have bleb formation with reddened bases. Third degree burns involve all three layers of skin exposing the body to infection and loss of fluids, which can quickly bring on shock and possibly death, unless the patient is given intravenous fluids. A third degree, deep, burn involves the full thickness of the skin and extends into the subcutaneous tissue with charring, loss of substance or discoloration. These are frequently not painful due to nerve destruction. Third degree burns destroy the skin layers and go deeper into the flesh. Nerve endings get destroyed so they don't hurt, but they may be surrounded by a second degree burn which will hurt. The skin looks charred. Third degree burns must be treated by a professional. Immediately apply cold water or ice to heat burns. This will stop the burning and limits the injury. For a sunburn, use a cool compress or a cool oatmeal or baking soda bath. Don't break burn blisters. If blisters break by themselves, leave them be. Keep the burn area clean. Don't bother with the ointments at the drugstore or other old home remedies like butter. They don't really help all that much. If the pain of a burn persists for 2 days or more, get medical attention. When you get burned, as soon as possible, remove the source of the burn. Quick immersion into cool water will help eliminate additional heat from scalds or burning fuels and clothing, or otherwise suffocate the flames with clothing, sand, etc. Strictly defined, a burn is damage to skin from heat above 120 degrees Fahrenheit, which may be caused by a hot water, fire, hot metal, chemicals, electricity, or gases. The most common source of burns happen in the home, and the most common place in the home is the sink, where the hot water is turned too high, especially for kids. The recommended settings if you have kids is 120 degrees. The second most common source of burns is with cooking, parents and children alike. Severe burns can occur from improper microwave usage. Eating foods that are too hot also causes burns. The best way to deal with it is to allow food to sit for a minute or two before you eat it. First-degree burns involve only the upper layer of the skin, the epidermis. The treatment for these are: rinse with cold water for 5 to 10 minutes. Don't use ointments or greases. Do not break blisters. Cover with sterile dressing or clean cloth held in place by a non-adhesive material such as aluminum foil. A cold pack made up of ice cubes in a plastic bag covered with several layers of cloth may relieve the pain of a fresh burn. Leave it in place for about 15 minutes. Running will fan flames and increase the injury. For mild burns, clean the area with soap and water, lance blisters, and apply a sterile gauze dressing changed every 2 days. A raw potato on a mild burn will help soothe it. Severe burns are treated as just described, however, the patient will also have to be treated for shock symptoms. Make the patient drink lots of liquids as possible to help with the healing process. Try something like Gatorade to replace the lost sodium. If the patient's face is burned, you might have to do fluid replacement via 4. When fire is involved, smoke may cause inflammation of the lungs and damage to the eyes. Electricity could cause heart damage as well as a burn. In summary, for moderate burns, use cold water to clean the area. For serious burns, cover the area and go to the hospital. For chemical burns, flood area with water and call the doctor. There are lots of holistic treatments for burns. Some are as follows. Use St. John's wort, vitamin E, zinc, bromelain herb, cantharus, phytonutrients, comfrey herb. You could apply any of the following substances on the burn: aloe gel, baking soda paste, milk compress, vinegar, wet tea bag, honey, Vaseline, cold water, raw onion, raw potato, raw pumpkin, garlic oil, vitamin E oil, sauerkraut, apple butter. Books about burns are number 617.51 at the library. GFBF.org, Georgia Firefighters Burn Foundation, Atlanta. Burn.if.org, IF Burn Foundation. Burnfree.com. Burnsarchive.com. Burnsurvivor.com, a resource center for burn victims, their families, and those who have experienced catastrophic burn injuries or wrongful death from third-party negligence. Burnsurfixforcetw.org. Crashandburnkit.com, Burn Gel. drugs.com/enc/image_pages/8601.html, second-degree burn medical information. en.wikipedia.org/wiki/burn_left-injury right-. American Burn Association. 625 North Michigan Avenue. Number 1530. Chicago, Illinois 60611. 800-548-2876. AmeriBurn.org. Burn Survivors Association. Ross Tilley Burn Center. Wellesley Hospital. 160 Wellesley St East. Toronto, on M4Y1J3. 416-791-0545. 416-926-7021, info line. Burns United Support Group. 441 Colonial Court. Gross PT. Farms, Michigan 48236. 313-881-5577. Immune Deficiency Foundation. 40 West Chesapeake Avenue. Number 308. Towson, Maryland 21204. 800-296-4433. 410-321-6647. Fax, 410-321-9165. PrimaryImmune.org. Institute for Burn Medicine. 3737 5th Avenue. Number 206. SD, California 92103. 714-291-4764. National Burn Victim Foundation. 32 Scotland Road. Orange, New Jersey 07050. 201-731-3112. Help Burned People. National Institute of Burn Medicine. 909 East Ann St. Ann Arbor, Michigan 48104. 313-769-9000. Phoenix Society for Burn Survivors. 11 Rust Hill Road. Levittown, Pennsylvania 19056. 215-946-2876. 800-888-2876. info@phoenix-society.org. phoenix-society.org. Primary Immune Deficiency. 800 Jeff 844. Cryosurgery in general for wart and heel spur removal. Cryosurgery is a method of superfreezing tissue using liquid nitrogen in order to destroy it. Cryosurgery has often been used to freeze off warts, heel spurs and other skin abrasions in the hands and feet. The technique is also used to treat cancerous tumors, mostly in the liver, prostate, and cervix. Berkeley.edu/cryosurgery, American College of Cryosurgery. Cryogenic-Society.org/cryo_central/cryosurgery.php, Cryogenic Society of America. Hives/urticaria/nettle rashes. Hives, aka urticaria, are an outbreak on the skin. They are an allergic reaction of the autoimmune system to some stressor in the environment. Hives could be caused by almost anything: stress, weather, emotional tension, etc. Out of all the possibilities in the environment and in life, finding the exact cause can be tough. It could be general stress. Some of the common things that can cause hives are as follows: animal dander, berries, dairy products, drugs, eggs, freshwater fish, insect bites, nuts, pollen, pork, shellfish, wheat. The only sure way to determine exactly what causes hives is to expose yourself or get the doctor to expose you with each of the common stressors that you are regularly exposed to in daily life. If you react strongly, you know you have just discovered at least one of your hive precursors. There could be just that one, there could be more. With allergies in general, hives is but one manifestation. There could be others like difficulty with breathing or circulation, so be careful when exposing yourself to possible stressors to try to find the cause. An attack of hives often lasts from a period of a few minutes to weeks. Single hives on the arm, leg, or torso are quite common and not considered dangerous. In your search to find the cause of your hives or allergies, monitor your daily schedule. Do they appear after you eat? After you eat a certain food? Do they happen after you're out in the cold or in the heat? How about the time of year? Do you go near gardens with flowers? If the allergic reactions seem to be caused by foods, a treatment some medical experts suggest is to go on a diet of lamb and rice until the hives stop or disappear. Lamb and rice have been proven to virtually never cause allergic reactions. While on this diet of lamb and rice, Reintroduce other foods back one by one, starting with the ones you think are causing the hives first. If you get an allergic reaction, that could be your trigger food. This process is called an elimination diet. If the hives itch, apply a cold compress and use over-the-counter medicines to help deal with it. If the patient is suffering a severe bout of hives with dizziness and/or difficulty breathing, the doctor may give the person an injection of adrenaline and other similar drugs. If it's hives alone, the doctor will either prescribe an antihistamine or use adrenaline injections to relieve swelling and itching. allergy.clinic.co.uk/urticaria.htm babycenter.com/0_hives_108886.bc botw.org/top/conditions_and_illness/skin_disorders/hives centerwatch.com, clinical studies. chronichives.com, International Chronic Urticaria Society. cure-guide/child_health_guide/child_health_guide.html dermatechrx.com/hives, treatment. drgreen.com/54_21.html drsears.com/html/8/t0824000.asp gastrointestinal-illness.com healia.com Impetigo info. Impetigo is a rash that begins as small red spots that become tiny blisters that eventually rupture, oozing out a sticky, brownish crust. Impetigo is a skin infection. It is caused mostly by streptococcal and staphylococcus bacteria, but occasionally, other bacteria contribute to it also. Impetigo is characterized by blisters that may itch. The types are bullous, with blisters, and non-bullous, without blisters. Treatment is with antibiotics. Impetigo is most common among children aged 2 to 6 years. People who play close contact sports such as rugby, football, and wrestling are also susceptible. The problem is that this rash can spread very quickly over the body. When you scratch with your hands and you touch other parts of your body, you spread the bacteria and the rash. There is usually a lot of itching with impetigo. After the impetigo sores heal, there may be slight scarring and a slight change in the skin tone at the site. This could change back to normal over time, or it could be a permanent minor discoloration. There is a rare reaction to streptococcal bacteria infection, which is a kidney problem called glomerulonephritis. If you're afflicted with glomerulonephritis, your urine will turn a dark brown color. Side effects include headache and high blood pressure. Glomerulonephritis doesn't usually last very long and heals completely in most people. Antibiotics will help heal the impetigo but won't prevent glomerulonephritis. If the impetigo is only a few lesions, you can treat it yourself by soaking the crusts in warm water or Boros solution, Domburo, Blubbera, etc., until it softens enough to dissipate. After this, wash the area with soap and water. Use an antibiotic ointment if desired, like Neosporin. If the impetigo doesn't go away over time or are spreading, go see a doctor. The doctor will probably prescribe either an oral antibiotic or an antibiotic called mupirocin cream. He or she may check the blood pressure or urine to look for early signs of glomerulonephritis. bestin-cosmetics.com/skin-disorders/impetigo.htm britannica.com/eb/article-9042215/impetigo dermenitnz.org/bacterial/impetigo.html drgreen.com/21_1124.html emedicine.com/derm/topic195.htm emedicinehealth.com/impetigo/article_m.htm en.wikipedia.org/wiki/impetigo liver spots/age spots/solar lentigo/senile lentigo. Liver spots are flat brown black spots that usually occur in sun-exposed areas of the body as a person ages past 50. Some people think they could be caused by impaired liver function or nutritional deficiency, but there's no proof beyond aging and too much sun. Liver spots are not cancerous, but they can be removed for cosmetic reasons. They have nothing to do with the liver or liver function. Current treatments are cryotherapy, freezing, and cosmetic laser treatment. 123-HEALTH-and-d-beauty.com/dermatology/liver-spot.html 30glycolic.com, fade liver spots and age spots. actifade.com/liver-spot-treatment.htm, skin blemish treatment cream. ourclinic.org/testimonials.asp test ID =39, castor oil for a liver spot, holistic view. blemish-be-gone.com/liverspot removal-p-154.html blissworld.com, Bliss Sleeping Peel Liver Spot Lifter. bodyconcept.com/family/4644/reviews.html, reviews Bliss Sleeping Peel Liver Spot Lifter. Morgellons disease info. Morgellons disease is a skin disorder that causes mysterious scabies and ectoparasites on the skin. Some people say it's a product of the human imagination. Others say it's caused by chemtrails, chemicals in our environment, and some say it's a man-made disease like AIDS. Morgellonsexposed.com, Morgellonsresearchfoundation.com, Morgellonswatch.com. AnnaIbendi.blogster.com/morgellons_disease.html. bibleprobe.com/morgellons.htm. boomantribune.com/comments/2005/12/102/104634/93/7. canleyme.com/morgellons.html, Morgellons disease linked to Lyme disease. chemtrailcentral.com. Psoriasis info. Psoriasis is a common skin disorder characterized by thick, reddened skin often covered by scales as a result of excessive formation of skin cells. In severe cases, the psoriasis can form into pus-filled blisters. It is believed to be a type of autoimmune disorder. Mild forms are generally treated with over-the-counter ointments, creams and lotions. More severe forms are often treated with drugs. The areas most commonly affected are the scalp, elbows, arms and legs, knees, groin, genitals, and your nails, toenails, and lower back. The cause of psoriasis may be linked to an abnormality in the function of white blood cells that somehow triggers inflammation in the skin. Parts of the skin grow too rapidly, causing a buildup of reddish areas with silvery scales that flake off. The most common places that psoriasis affects are the scalp, elbows, knees, lower back. Doctors can diagnose psoriasis by taking a sample of the skin and examining it under a microscope. A variety of different treatments, creams, corticosteroids, light therapy and oral medication are available. PUVA, Freelance and Ultraviolet A, combines ultraviolet light therapy with the oral medication Freelance. Methotrexate is a prescription drug with side effects. Though the cause of psoriasis is unknown, it is apparently a genetic disorder, affecting both genders, appearing at any age. Another theory states that psoriasis is caused by a deficiency of fumaric acid. By fumaric acid supplements, BRJ Dermatol 98, 138, 3456-460 and BRJ Dermatol 05, 152, 4597-615. Psoriasis is not contagious. Sometimes there is a little itching. The lesions are dry and rarely become infected. Studies have shown that psoriasis involves an abnormality in the mechanism in which the skin grows and replaces itself. This abnormality is related to the metabolism of amino acids. Factors that aggravate and precipitate the outbreak of psoriasis are injury to the skin in the form of cuts, burns, minor abrasions, changes in the seasons, physical and emotional stress, infections, and use of certain medicines for the treatment of other diseases. The holistic people say that psoriasis is a metabolic disease. They say do a juice fast for about 3 days, get an enema, move to a diet of healthy foods and get some exercise. The patient should use vitamin E in therapeutic doses from 200 to 800 IU a day. The patient should take lecithin capsules. Soap should not be used. Regular seawater baths and application of seawater externally over the affected parts once a day are beneficial. The hot Epsom salts bath is good. After the bath, a little olive oil may be applied. In many cases, psoriasis responds well to sunlight. Cabbage leaves have been successfully used in the form of compresses in the treatment of psoriasis. They should be warmed and then applied smoothly to the affected part in an overlapping manner. A pad of soft wooden cloth should be put over it. The whole compress should then be secured with an elastic bandage. Some people use mud packs in the treatment of psoriasis. Live a relaxed life. I saw a posting at the psoriasis.org forum about using electromagnetic therapy on psoriasis. Psoriasisnet.ch, Psoriasis Bo RT Vale Mountain Clinic, special clinic for the treatment of psoriasis, psoriatic arthritis, and neurodermatitis. vitawise.com/right/psoriasis.hdm. dailymail.co.uk/article-1025346/I-spent-20-years-looking-cure-unlikely-place.html. wrinkle-skin-tips.com/psoriasis-treatment-cure.html. psoriasis.org. psoriasis-tab.com. biogeetica.com/psoriasis. psoriasiscure.net. psoriasis-cure-now.org. psoriasisfishcure.com. all-natural-treatments.com. bioantioxidant.com. psoriasis-tab.com. psoriasiscured.com. psoriasisconnect.com. psoriasistalk.com. psoriasiscures.com. psoriasisguide.com. psoriasis-help.org. psoriasis-help.org.uk. psoriasisinfo.com. psoriasis-info.com. psoriasissociety.org, 800-656-4494. psoriasis-tab.com. psoriaticdiseases.com. rarediseases.org, 800-999-6673. National Psoriasis Foundation. 6600 Southwest 92nd Avenue. Number 300. Portland, Oregon 97223. 800-723-9166. 503-244-7404. Fax, 503-245-0626. Get info at npfusa.org. Psoriasis.org. Support/professional organization for this skin disorder. Psoriasis Research Association. 107 Vista del Grande. San Carlos, California 94070. 415-593-1394. Psoriasis Research Institute. 600 Town and Country Village. Palo Alto, California 94301. 415-326-1848. All-around support group providing referrals, resources, and treatment. Psoriasis Society of Canada. POG 25015. Halifax, NSB 3M4H4. Canada. 800-656-4494. 902-443-8680. Fax, 902-457-1664. Info at psoriasissociety.org. psoriasissociety.org. Rosacea info. Rosacea is a disorder of the skin characterized by redness. It is caused by microscopic mites who set up housekeeping in the oil glands and produce the redness and the bumps. Oxy-10 and other over-the-counter drugs containing benzoyl peroxide are effective in killing the mites. The prescription drug metronidazole is also highly effective. Rosacea.org. acnerosacea.org. purelicer.com/rosaceaclearing.html, heal and clear rosacea in Chicago and Toronto. groups.yahoo.com/group/rosacea-cure. National Rosacea Society. 800 South Northwest Highway. Number 200. Barrington, Illinois 60010. 888-662-5874. 800 No Blush. 708-382-8971. Rosacea@aol.com. Rosacea.org. Rosacea Awareness Program. 300 to 105 Commerce Valley Drive West. Thornhill, QC. 800-467-2081. Rosaceainfo.com. Sarcoidosis Info. Sarcoidosis, is an inflammatory autoimmune disease that can affect the skin and a variety of organs, most often in the pulmonary system. Although children and older people can get it, sarcoidosis is most common in people between the ages of 20 and 40. It affects more women than men. Symptoms include shortness of breath, chronic cough, and skin rash. Sarcoidosis can attack any organ of the body in any location. The inflammation produces tiny lumps of cells in various organs in the body. netdoctor.co.uk/diseases/facts/sarcoidosis.htm, sarcoidosis. medicinenet.com/sarcoidosis/article.htm, sarcoidosis causes, symptoms, diagnosis nhl.bi.nih.gov/health/dc/sar/c/sar_what is.html, what is sarcoidosis? Sarcoidosisonlinesites.com. StopSarcoidosis.org, Foundation for Sarcoidosis Research. Sarcoidosis Family Aid and Medical Research Foundation. 460 Central Avenue, E. Orange, New Jersey 07018. 800-203-6429. 201-399-3644. Sarcoidosis Family Aid and Medical Research Foundation. 460 Central Avenue, E. Orange, New Jersey 07018. 800-203-6429. 201-399-3644. National Sarcoidosis Resource Center. POB 1593. Piscataway, New Jersey 08855-1593. 908-699-0733. Sarcoidosis Foundation. POG 22868. Newark, New Jersey 07101-2868. 201-923-8818. Shingles/varicella zoster virus, VZV. The virus varicella zoster virus, medically called herpes zoster, causes chicken pox and sometimes shingles. Shingles is a blistering skin rash most common in older people and people who have weakened immune systems. Try St. John's wort herbs. Take lysine pills. Apply any of the following to the cold sore: baking soda and water, Epsom salts and water, aloe vera, vinegar, witch hazel and geranium oil. Books about shingles are at number 616.522 or RC147. ama-assn.org/aimednews/2006/11/13/HLSC1113.htm, shingles vaccine. amoils.com/shingles.html. medterms.com. myshingleska.com. natural-health-treatment.html/shingles-medical-treatment.html. natural-treatment.shingles/shingles-medical-treatment.html 9s.nih.gov/health_and_medical/disorders/shingles_doc.htm nlm.nih.gov/medline+/nc/article/0008558.htm salicyl.com, ointment. shingles.mgh.harvard.edu, the Center for Shingles and Post-Herpetic Neuralgia. shinglesinfo.ca. vzvfoundation.org. Vitiligo info/leukoderma info. Vitiligo is a disease where the melanin-producing cells are absent. The word literally means white skin. There is a gradual loss of pigment melanin from the skin layers which results in white patches. The condition does not cause any much harm to the body, but it looks ugly. The main causes of leukoderma are stress, gastric disorder, impaired liver function such as jaundice, worms, or other parasites in the alimentary canal, ailments like typhoid which affect the gastrointestinal tract, defective perspirative mechanism and burn injuries. Often the hormone-secreting glands are involved in this disorder. About 30% of patients have a family history of the disorder. Try to live a pure healthy life. Relax. Eat healthy foods. Exercise. Avoid tea, coffee, alcoholic beverages, and all condiments. Avoid sugar, white flour products, denatured cereals like polished rice and pearled barley, and tinned or bottled foods. Bobchi seeds combined with tamarind seeds ground up and made into a paste put on the afflicted area could help. Mix red clay with ginger juice and apply it over the white spots once a day. The copper in the clay seems to bring back skin pigmentation, and ginger juice serves as a stimulant, facilitating increased blood flow to the spots. Drink water kept overnight in a copper cup. A paste made from the seeds of the radish helps in treating leukoderma. Create a paste of turmeric and mustard oil and put it on the white spots. vitiligo-disease.com/vitiligo-treatment.php vitiligoguide.com, vitiligo treatment, news, and products. antivitiligo-oil.com, vitiligo, vitiligo treatment, vitiligo cure, skin disorder. National Vitiligo Foundation. 601 South Fleischl Avenue. epub 6337. Tyler, Texas 75711. 903-534-2925. 903-531-0074. Fax 903-525-1234. vitiligo@trimofrown.org. nvfi.org. Support organization for this skin disease that destroys the color pigmentation of skin. Canadian Vitiligo Society. Western Hospital. 8th floor, number 542. 399 Bathurst Street. Toronto, on. 416-603-5953. Wart removal info. Verruca vulgaris is the medical term for warts. Warts appear on the hands, the feet, and the face, caused by a virus like the HPV virus. Plantar warts are caused by a virus. They are mostly found on the ball of the foot. They are not like calluses, which are just thickened skin, because they are a circular wart with a definite, distinct growth to them. Warts usually are raised, rough and ash-colored, but can also be dark, flat, and smooth. There are several different types of warts. Common warts typically grow on the hands and angers in areas where the skin has been broken, such as near bitten, anger nails or picked hangnails. Plantar warts are foot warts. Flat warts are small. They grow in clusters of 20 or more. Warts are contagious. The virus can be passed from person to person. Warts should be treated promptly to prevent spreading them. The preferred method of removal is freezing with liquid nitrogen. Other methods are acid plasters, medicated creams, or surgical removal. There are hundreds of holistic remedies for warts. Here are a few. Put garlic or garlic oil on the wart. Rub the wart with a paste of buttermilk and baking soda, cinnamon oil, wheat germ oil, bacon rind, radish, juice of marigold, white chalk, spittle, fresh fig, the suberances in a dandelion stem, aloe vera, molasses, vitamin E oil, raw potato, lemon juice, raw onion, used tea bag, pineapple skin, a mix of olive oil and sliced carrots. Soak your wart in water that was used to boil eggs. People have meditated their warts away. Drink chamomile tea. Wartemolevanish.com, Wart Treatment, the world's only single application mole, skin tag, and natural wart treatment system. Altcancercream.com. amoils.com/warts.html. Wartemolevanish.com. wartner-us.com. wart-removal.com. wart-removal.net. yourmedicalgroup.com, Laser Wart Removal. Chapter 6. Fungal Infections Info. Ringworm/Tinea corporis/dermatophytid. Ringworm is a contagious fungal infection of the skin and the scalp. It can exist anywhere on the body, the skin, groin, hands, scalp. It has nothing to do with worms. Ringworm on the scalp usually leaves a bald spot of scaly skin. Ringworm can affect skin on your body, tinea corporis, scalp, tinea capitis, groin area, tinea cruris, also called jock itch, or feet, tinea pedis, also called athlete's foot. Ringworm is easy to treat. Ringworm is the common name for the skin infection caused by a special group of fungi. The fungi feed upon the dead cells of skin and hair, causing, in people, a classic round red lesion with a ring of scale around the edges and normal recovering skin in the center. Jock itch, athlete's foot, and ringworm are all types of fungal skin infections known collectively as tinea. Most are easily preventable and treatable. Ringworm, or tinea corporis, is a common fungal infection resulting from dermatophytes, which are microscopic organisms that live off the dead outer layer of skin. Ringworm can affect anyone at any time. The term is derived from the red ring that appears on the skin caused by the condition. Ringworm begins as small, round, red spots that get progressively larger. When they get to the size of a pencil eraser, the center begins to clear. When these lesions get bigger, they look like a ring, the border being reddish and scaly. Although rare, ringworm could also affect the scalp or nails. The most common treatment is topical antifungals applied on the skin, available over the counter in cream, solution, and powder. If the ringworm doesn't improve in a week or so, go see a doctor. The doctor will either scrape the scales and soak them in a potassium hydroxide solution or culture them, then view them under a microscope to confirm or reject the diagnosis. If topical antifungals fail, the doctor will prescribe oral antibiotics. For ringworm in the scalp area, the doctor uses an ultraviolet light called a Wood's lamp, which will cause the affected hairs in the infected area to light up. This confirms the diagnosis. Ringworm of the scalp is then treated by oral antibiotics. Related infections are athlete's foot and jock itch. drfungus.com. Ringworm.biz, ringworm, symptoms and colloidal silver home remedy. ringworm-center.com. ringworm-guide.com. ringwormrx.net. rxinsider.com/monographs/ringworm.htm. symptoms-ringworm-treatment.com. webmd.com/skin-problems-tc/ringworm-of-the-skin-topic-overview. Athlete's foot/tinea pedis/dermatophytosis. Athlete's foot is the most common fungal infection that occurs in the foot area. Because of the moisture caused by both the foot sweating and walking through puddles in the rain, the bacteria grows faster, further aggravating the problem. In the typical sports locker room or a common shower facility such as with dorms, people walk around barefoot, so if someone has this fungus, it can be easily picked up by others walking around. This is why conscientious people wear some kind of footwear, even if they are walking from their lockers to the shower. They don't want to take that chance of picking up the fungus. Wash your feet thoroughly all the time. Clean the space between the toes with soap and warm water, then dry the area with a towel, particularly between the toes. The tinea fungus readily grows in moist, damp areas such as shower stalls and ores. Sweating and inadequate ventilation of the feet help the fungus grow. The affected skin itches, peels, cracks and forms scales or blisters. Your doctor will examine the affected areas of your skin and may remove a small sample of skin to examine under a microscope. He or she will prescribe an antifungal cream. If the athlete's foot is severe, he or she may prescribe oral antifungal medication. Try to wear footwear that allows the feet to breathe, which means shoes or sneakers that allow oxygen to flow in and out, thereby minimizing sweat accumulating in the area. Some people wear a particular pair of footwear one day, then the next day they wear something else to allow the first pair to dry. Over-the-counter powders such as Desonex help keep the feet dry. The common signs of athlete's foot are redness of the feet, scaling between the toes, small blisters and itching. Topical antifungals help with the condition. If you go to a doctor, he or she will look your feet over and possibly do a skin scraping, then examine it under a microscope to come to a diagnosis. Another condition called dyshydrosis is similar to athlete's foot. In extreme cases, oral antifungals are prescribed. Sunlight kills the fungus, so try to get outdoors. Use rubbing alcohol on the feet. Rub a garlic clove over infected areas. Clean your feet with vinegar. Dermatechrx.com, drroths.com, ehow.com, how to make a foot soak to cure athlete's foot. en.wikipedia.org/wiki/athlete_s_foot. family-health-remedy/home-remedy/athlete_s_foot.htm. feetforlife.org. foot.com/info/cond_athletes_foot.jsp. footsmart.com, comfortable shoes, socks, and foot care products to relieve foot problems. fungrx-ringworm-treatment.com. giantmicrobes.com/maladies/athletesfoot.html. healthopedia.com/athletes-foot. healthscoot.com/nc/68/718/main.html. kidshealth.org/kid/problems/skin/athletes_foot.html. mayoclinic.com/health/athletes-foot. jock itch/tinea cruris/groin dermatophytosis. Jock itch is the common term for the fungal infection of the genital area, which is called tinea cruris by the medical community. It is also called ringworm of the groin and fungal groin infection. Jock itch affects the genitals, inner thighs, and buttocks. It appears as a red, itchy rash. It is often ring-shaped. Tinea thrives in warm, moist areas of the body. Infections occur in the summer and in warm, wet climates. Jock itch is caused by fungi called dermatophytes. It is aggravated by friction and moisture. For the most part, this is a male disease, but women, particularly athletic ones who sweat a lot, can get it too. Tinea cruris can infect other areas of the body such as the feet and the area between the toes, where it causes athlete's foot. The infection begins as small, red spots that enlarge to form rings. At the edge of the ring the skin is raised, red and scaly. Jock itch is somewhat contagious. You can get a tinea infection from wet surfaces such as a locker room, from another person, or even from an animal. Apply an antifungal cream to the groin area daily for at least a month. There is oral antifungal medication. The most common treatments are to clean all clothing and athletic equipment that goes near that area regularly. If some article of clothing rubs against you, get rid of it, use something looser. Apply foot powder or baby powder to the area to help keep it dry. Clean yourself regularly. Take showers. Wear loose-fitting clothing and cotton underwear to give the genitals a chance to dry. Don't use other people's clothes or towels. There are over-the-counter and prescription fungal treatments. Topical antifungals are a common treatment. If it gets serious, the doctor will prescribe oral antibiotics. Yeast infection is a related condition that girls often get. If you go to the doctor, he or she may take a scraping and examine it under a microscope in order to make a diagnosis. allstop.com/jockkitsch, product for sale. amoils.com/jock-itch.html. en.wikipedia.org/wiki/jock_itch. en.wikipedia.org/wiki/tinea_cruris. familydoctor.org/handouts/316.html. fonoils.com, holistic product. Fungal infection websites. familydoctor.org/online/fam/dio/common/infections/common/fungal/3. emedicine.com/derm/fungal_infections.htm, fungal infections. Chapter 7. Holistic skin remedies. Holistic skin remedies. Don't scratch skin problem areas because the skin could get infected. Apply some of your urine on problem skin. Some substances to topically apply on rough skin areas or to beautify the skin are vegetable oil, grated horseradish mixed with alcohol, baking soda, a paste made out of lemon juice, olive oil, and sea salt, puree of vegetables, a paste of pineapple, papaya, and honey, a paste made out of strawberries, yogurt, and lemon juice, a paste of eggplant and yogurt, mustard, cornstarch, tofu, honey, condensed milk, skim milk powder paste, vinegar, olive oil, aloe gel, sea salt with water, sarsaparilla root and water, sliced vegetables, vitamin C tablet dissolved in water, lemon juice, strawberries with vinegar, lemon juice, Miracle Whip mayonnaise, papaya, ground up almonds mixed with water, avocado, grapefruit, beer, potato water, yogurt, banana peel, cooked cabbage, tomato, sesame oil, sliced onion, cooked onion, vinegar, and cornstarch paste, cream of tartar with water, baking soda and water, buttermilk, wheat germ oil, thyme tea, rum, garlic or garlic oil, cod liver oil, egg whites, liquid lecithin, banana skin, mud, lemons, oatmeal paste, cucumber juice, buttermilk, liquid vitamin C and vitamin E oil. Some herbs and foods which help with skin health are fish oil, flax seed oil, raw potato, burdock, brown rice, brewer's yeast, safflower oil, apple juice, lecithin, cayenne, pumpkin seeds, fish oil, licorice root, pulsatilla, sepia, chamomile, echinacea, milk thistle, tea tree oil, flax seed oil, echinacea, enzymes, ipraflavone, lomatium, vitamin C, carotenoids, coenzyme Q10. Use warm water when washing your face. Hot water could break blood vessels. Drink yarrow tea to reduce oiliness in the skin. Remove makeup using condensed milk with cotton balls or vegetable shortening. Use avocado and sour cream on dry skin. Wash your face twice a day. Try a non-prescription spray containing zinc pyrithium. Holistic Skin Remedies websites. 1stholistic.com/beauty/skin/skin_oily_skin.htm. angelaharris.com. aurhelp.com/dry_skin.htm, dry skin treatment. bestlookingskin.com. best-skin-solutions.com. bioskincare.com. chanel4.com/health/microsites/l/look_young/treat_face.html. sealeralder.com. drhauschka.com/holistic-treatments. eacnetreatments.com. easinarticles.com/question-skin-allergies-14-holistic-treatments-that-work. glowholistic.com. growsbart.com, skin treatment program. herbal-treatment.net/skin_treatment.html holisticcareapproach.com/pages/facials holisticskin.com holisticskinTherapy.net holisticway.net elecachespa.com Holistic Skincare Spa NYC mygroundmat.com/pretty.html pretty natural holistic skincare naturopathica.com/skincare-treatments.html redrockhealing.com/skincare/skincare.html reducedarkcircles.com/links/naturalhealth.html altivoe.com/skin_treatment.html ronalane.com shirleys-wellness-cafe.com/skin.htm shizukanewyork.com New York City Day Spa and Skincare Treatment skincare.lovettono.com skinsecretsexposed.com skandtreat.net soulspasudio.com/services/holistic_skin.htm thsprayingsoftclifton.com/services-holistic-care.php trustedhealthguide.com truthspa.com/advancedskin treatment.htm uniquefacials.com Advanced European Facials Institute webmd.com/skin-problems-and-treatments bestSkincareProducts.org cureacnezone.com